Okay. Well, we might wait till 1:30 to decide because that was the time on the published agenda. So somebody may come in at 1:30 and expect to be able to make comment. We'll wait another 10 minutes, members. Sorry.
Hi, Jerry.
How are you, Senator? We're going to wait till 1:30 to see if there's anyone coming in for public comment. So far, there aren't anybody. There aren't any people here to comment, so we'll wait. And Andy, do we have the panel ready?
It doesn't seem like they're on yet, Mr. Chair.
They are on, Andy.
Okay. I stand corrected.
Yeah, I was going to wait till after public comment, but
Sure.
they
So
are.
Okay.
Good. Thank you, Nancy and Andy. We'll wait till 1:30. I'll ask if there's any public comment. If not, we'll go right to the panel.
I'm just curious, how does one figure out how to public comment? Do you go to the website, or I don't know how it works.
Go to the website and there are instructions. There's a link.
So wait, so you're saying the 28th you've got a test? Okay.
Okay, it is 1:30, so we will reconvene. And do we have anybody signed up yet for public comment?
I don't believe so, Mr. Chair.
Okay, well then let's move right into our afternoon panel, and that'll be serving sexual assault survivors. And it'll be Angel Charlie, the Executive Director of the Coalition to Stop Violence Against Native Women, Alexandria Taylor, the Deputy Director of the Coalition of Sexual Assault Programs. So welcome, and whichever one of you is going to go first, go ahead and begin.
Good afternoon, Mr. Chair, members of the committee. It's so good to see you. I also wanted to share that we have added Stephanie Villalobos, the Executive Director of Valencia Shelter Services, to our panel, if that's okay with you.
That's fine. That's great. Thanks.
Thank you so much. So, as Mr. Speaker said, I'm Alexandria Taylor, the Deputy Director with the New Mexico Coalition of Sexual Assault Programs. I'm grateful to be here with you today, and I will just allow Angel and Stephanie to introduce themselves before I jump into our presentation. Stephanie or Angel? Okay.
Guatsi Hoa. Great to be here with everyone. Thank you for having us. I'm the Executive Director of the Coalition to Stop Violence Against Native Women, and we're really grateful for the opportunity to speak with you today and talk about some of the needs that we've seen come up since March, and look forward to a great session coming up next year and all of the innovation that it's going to yield in this new reality of ours. So thanks for having us.
Good afternoon. My name is Stephanie Villalobos. I'm the Executive Director of Valencia Shelter Services. Great thanks to you for sitting and listening to us speak today. I appreciate your presence. I appreciate you giving us time in order to really just open up a little bit more about what's kind of going on in the state of affairs right now. So thank you so much for allowing us to speak.
Thank you, Angel and Stephanie. And am I able to share my slides, or are you, Nancy, are you able to share? Awesome.
You have present. There you go.
Thank you so much. We're all getting used to this technology. So, addressing sexual violence, you all have heard from some of our amazing community partners this morning with those addressing domestic violence and those addressing child abuse. We're grateful to work with them, and I think a lot of what we will share will resonate and echo what they shared with you this morning, and also give the lens specific to sexual violence. We have 11 sexual assault service providers across New Mexico, 13 counting our 2 satellite offices that have been stood up in rural communities, and much thanks to you all's continued support through the legislature in funding these much needed services, as well as 11 sexual assault nurse examiners that are providing post-assault medical care and forensic medical exams for child victims of sexual assault, as well as adult victims of sexual and domestic violence. And here at the Coalition, we have the great fortune of being able to support and help coordinate and fund all of these great providers as they provide services to survivors of sexual assault. So just a quick overview of NMCSAP as the statewide entity that provides technical assistance and pass-through funding to providers, as well as training. We provide state-of-the-art trauma survivor-centered training and conferences for advocates, therapists, prosecutors, law enforcement, and many others, and I'll go deeper into that. I wanted to give you an update on some statewide efforts of things that we have come to you before And so that we can give you an update of the status of where things are at. The Sexual Assault Evidence Kit Tracking System is a new system that evolved out of the sexual assault kit backlog that you spent many years hearing about and supporting the state and city of Albuquerque labs in catching up in that backlog and getting that backlog processed. That has now happened, and so we have now implemented a system that includes barcoding each kit. So as that kit moves through the system, it is scanned in and can be tracked. And through the Survivors' Bill of Rights that was passed in the legislature a few years ago, survivors now have access to be able to call to receive an update on the status of where their kit is at. So really empowering for people to know that their kit is not sitting on a shelf at a law enforcement or at a police department, but can actively be involved in what is happening in their process. As you heard this morning around prosecution training, we continue to provide ongoing prosecution training. I was kind of excited this morning because just yesterday, our statewide annual report on the incidence of sexual violence was released. And so I have up-to-date in real-time information to share with you, but we know the need for continued training of the professionals responsible in helping to keep our communities safe and provide justice for survivors requires ongoing mentoring, coaching, and training. And then we continue to provide counselor training for therapists throughout New Mexico, not just those associated with New Mexico, with sexual assault programs, on the dynamics of sexual assault, neurobiology of trauma, and PTSD. And then continuing to work on establishing relationships with the Department of Corrections here at the state of New Mexico to ensure that survivors who are presently incarcerated or those who are at risk of being violated while in a detention facility have protections and assistance that they need, as well as technical assistance to the network of providers across our state. We have a team of preventionists that operate out of our sexual assault service programs who have really been involved in providing school-based education and primary prevention services. And since March, when schools were moved virtually and we were in a stay-at-home order, we had to really get innovative and creative about how to reach children, young people who are now at home without the structure of school and after-school programs and sports. And without being able to provide these essential services within the schools to really talk about primary prevention. And so our programs got really innovative and creative in developing sexual violence prevention and healthy relationship curriculum for teachers to be able to use and supplement in their virtual schooling environments. Creating innovative digital content, Hello TikTok, which I think Stephanie, I am aging myself now that I said that. I think Stephanie will talk a little bit more about that. But using where kids are at, and the reality is that kids are online, kids are on devices. And so being able to switch our outreach and prevention education to meet children where they are at during these times has been a really amazing thing that we've seen our programs do. Working directly with local businesses to market prevention messages in some communities. They are putting stickers on coffee cups at the local coffee shops, including information in grocery bags at the supermarket. And then one of our programs in Las Cruces, La Piñon, had for years been operating a text chat helpline for young people. And in March, when stay at home happened, they expanded that statewide, and it has become so popular that it is now actually receiving text and chats from around the nation. And so I think it's just really incredible how our programs have pivoted and continue to work to reach young people during this time. So the incidence of sexual violence in New Mexico and kind of where we are today, literally as of that report coming out yesterday, 41% of reported sexual assaults in New Mexico involve children under the age of 18. And so you heard from Carrie Lee talking about the wonderful work the children's advocacy centers are doing. And we also are in support of that work because child abuse also includes child sexual abuse. And so the overwhelming number of sexual abuse cases being reported in our state involve children. 1 in 4 New Mexico women report being victims of sexual violence. And in 2019, law enforcement actually reported a decrease in the average number of crimes related to sexual assault, comparing the 5-year period of 2015 to 2019 versus 2010 to 2014. But during that same time period, we're actually seeing an increase in the average number of survivors who are served by our sexual assault service programs across New Mexico. And we saw a 4% increase in 2015 to 2019. And so I feel like that is also relevant to the conversation that is happening in our community and in our society now, where we know that many survivors who seek help may not seek help from the criminal legal system. I also contribute this to the fact that through continued funding and increased support by you all in the legislature, we have been able to focus our services in rural communities and really expanding the capacity of that, as well as creating culturally specific services for sexual assault survivors in New Mexico. And so we have programs that are directly reaching out to those with disabilities who have also been sexually assaulted. The Latinx, immigrant, Spanish-speaking population, the Asian and Pacific Islander population, and the LGBTQ communities in our state. And I think those increases, those vulnerable populations are often a part of populations that do not traditionally interact with the criminal legal system. There was also a 3% increase in the average proportion of survivors with a disability. And we have really compelling data that the researcher from the coalition produced a few years ago that shows how increased the vulnerability is for those with disability of being sexually assaulted. And so to see that we are actually now seeing more people seeking services, I think directly relates to continuing to fund culturally specific services that directly target that community, as well as providing technical assistance and training so that all of our other providers are better, are increasing their accessibility for all survivors in New Mexico. There was also a 4% increase in the average proportion of survivors who were served, who were victims of sexual harassment. And I think this comes from us being able to hold the conversation about what sexual violence really is in our communities, and more people identifying that while it may not have been rape, sexual harassment is also on that spectrum of sexual violence. And then a 3% increase in the average proportion of those seeking services of spousal rape. And we are also seeing more male survivors reaching out for help. So in general, the more that we continue to talk about sexual violence, the more people who are starting to seek help, the more diverse people who are starting to seek help as well. So sexual violence during COVID-19, sexual assault service providers immediately began pivoting services, much like you heard this morning, during the transition of things in March. While reports of child abuse are down and child sexual abuse is the easiest thing to hide, right? Not only are children not going to school, but even on camera, teachers cannot generally screen for if a child has been sexually abused or harmed. Programs continue to need ongoing support for telehealth services. One of the major transitions was immediately to transition as many of our essential services to a telehealth format to do our part in assisting the state in flattening the curve. we recognize that many of the risk factors associated with sexual violence are the same risk factors associated with COVID-19 and the spread of the virus. So homelessness or houselessness, um, inefficient financial means, not having circles of support and isolation. Many of those are the same risk factors. And so our programs move to providing telehealth services in really outstanding ways. And what we have learned from COVID is, people would say COVID is the great equalizer. And we learned in New Mexico that is not true, right? COVID absolutely has had a disproportionate impact on our communities here in our state. And those most vulnerable often are those also that live in rural communities without access to the everyday mainstream resources that many of us have access to. And those same risk factors for sexual violence also were the risk factors for COVID. But also with those telehealth services comes the need to continue paying for those platforms, standing up quality, comprehensive services in a virtual format takes resources. And programs are also in need of resources to continue providing services as they have moved back to providing services in person. We learned that for some, actually being able to keep a counseling appointment via telehealth made access easier, but for many it did not. And so we are working to keep both models now because we want to keep the lessons learned during this time, but also be able to reach those that had not been able to access services. Initially, we made a joint request with the New Mexico Coalition Against Domestic Violence, the Coalition to Stop Violence Against Native Women, the New Mexico Children's Alliance, which is the chapter for the Children's Advocacy Centers, and the Coalition of Sexual Assault Programs, and the amount of $3.75 million for COVID-related relief. And this was to meet the needs of survivors, to be able to provide telehealth services, to be able to provide essential services. One of the major gaps that this time has shown us is that we have major gaps in our system for housing survivors of sexual assault. We have done a tremendous job of standing up services for domestic violence victims, and you've heard even that is maxed out. But we have not for too long focused on the housing needs and the homelessness of survivors of sexual assault. Sexual assault services did not receive any CARES Act funding. Sexual assault services was not included in either federal CARES Act. And so one of the things we are asking of you during the upcoming legislative session is really for sexual assault service providers and survivors to be first in line for any additional federal funds that come into the state to meet these needs. There are ongoing costs to continue providing these services. And as we're all aware, we're all anticipating that there will be budget cuts in this upcoming legislative session. And so at the time where we are meeting increased needs for services, we are also preparing for and bracing ourselves for anticipated cuts to the budget. Just a quick overview of upcoming legislative priorities. Again, we are asking that we be first in line for any additional COVID-related relief. We have come to you before around the affirmative consent bill that is sponsored by Representative Liz Thompson. We've spent the past year working in coalition with other community organizations representing young people of color and those who would be most directly impacted by this policy. And we think we will have the strongest version of this bill, which is really an educational and prevention bill that teaches that yes means yes, right? And that consent is not confusing. It's a yes or it's not. We recognized, our partners pointed out to us that the New Mexico Military Code actually still includes a marital rape exception. And so we've been working with partners here in New Mexico who are part of the military ranks and executive, and identified that we need to adopt the language of the Uniform Military Justice Act, so that loophole is closed in New Mexico. We continue to work on the criminal statute of limitations for child sexual abuse, which would open up that window for when a criminal case can be filed for the disclosure of child sexual abuse crimes. And amending the statute to make sexual consent law while in law enforcement custody impossible. So currently the law recognizes a power of authority in correction settings. So a corrections officer cannot consent, and a person who is currently incarcerated cannot consent to sex with a correction officer. But the same is not true for law enforcement and someone who is in their custody. And so we want to make sure that our law is clear about that. And I will now pass it over to Angel Charlie. Thank you.
Thank you, Alexandria. If I start to freeze, I may have to turn off my video because that's just what I've learned happens here. And then I don't see a place for me to be able to share my screen. Is that a possibility?
You should be able to now.
We'll pass you the ball.
Here. Well, I work on this. Is it okay to move over to Stephanie? Stephanie, is that okay with you while I try and get my system preferences and things so folks aren't waiting on me?
Sure.
Thank you.
Mr. Chair and committee members, thank you for allowing us to have these conversations of the current state of affairs of advocacy and how services are working for our victims of sexual assault in the state of New Mexico. It is a great honor that I get to raise their voices into this room to you, to allow for you to have a better understanding of what is happening so that we can continue to make sure that victims who are affected, families who are affected by this, are continuing to be a priority as we move forward. So thank you for all that. As I had said before, I am the Executive Director of Valencia Shelter Services. Valencia Shelter Services is a tri-service agency, meaning that we do support victims of domestic violence, sexual assault, and child abuse. So we do hold the operations for the Child Advocacy Center in Valencia County. As far as sexual assault services within our community, Valencia Shelter Services supports Valencia County, so Coral County and Torrance County. So those are our service areas for sexual assault services. We are one of the few agencies who offer shelter to victims who are impacted by sexual assault, just like a victim of domestic violence. We offer the same services that is tailor-fitted to the trauma that they have experienced. And it is in that services that I'm able to speak a little bit more about kind of the state of affairs that COVID has impacted us. One thing that Alexandria did talk about is how us programs had to quickly pivot. And I just wanted to highlight, and I know you have been hearing from other services today about how quick that pivot really was. And making sure that we have the services in place and COVID-safe practices in order to continue to offer services in a trauma-informed manner. I think that from my sister agencies throughout the state of sexual assault programs, to watch that pivot happen was definitely very humbling and very grateful to know that us programs really united in that moment in time. And it was because of the support that we were able to, with the coalitions here today as they speak. One of the things that we had to address within our pivot is our prevention services. Usually, prevention services are held within the school setting. So we're having conversations about healthy boundaries, about healthy relationships. We're having conversations about those hard subjects that sometimes it's really hard for parents to have conversations with their children about, and allowing kids to have that free space to ask questions and be inquisitive and know that they have a evidence-based place in order to ask those questions and get those answers so that they can make the best decisions for themselves. One of our pivots within that is because, you know, virtually all schools were moved to a online platform. We had to reach out to the kids in through social media, and I will be honest, the idea of putting all this kind of information on TikTok was a little bit interesting thought when we first had it, but I will say that our preventionist, Alex, they have been able to reach students and youth, not only just in New Mexico, but also through the nation. And asking questions about, you know, this is what's happening right now in my household. How can I be safe? And having those conversations over a social platform that allowed us to try to check in with kids in this moment of time, make sure that they're safe, and again, continue to offer that safe space for them to ask questions and know a little bit more about how to move through this world and make the decisions that they needed to make. So that was something that was a very interesting endeavor, but is one that we are working for. The next phase of our prevention efforts is going to be a podcast for youth, and we'll also have a YouTube channel. So we will be able to invite guests, have discussions on topics, and then add those to the social media platforms so that they can exist and be shared around many platforms. And I will say that we did have a lot of youth engage in this, and we're able to really provide youth direct advocacy in moments of this pandemic and how they're navigating this, and you know how some youth in New Mexico and around the nation, their home is not safe, as you've heard today. And so being able to offer a place for youth to have a safe space to have communication with us so that we can support them was something really beneficial in that. Moving forward, it is definitely something that we're going to continue to add to our services, as we realized it was a very youth-based movement and something that we saw a great engagement with. So that's something that we will continue to provide. Alexandra also did talk about the pivots that we had to do in the housing sector. And I know earlier this committee had many questions regarding the hotel workings with shelter and how that worked. And so I wanted to spend a little time addressing some of the things that we've seen in the rural community in Valencia County. And so, like I said, we provide shelter to both domestic violence victims and sexual assault victims. But what I have, in our experience, we have seen that the hotel spaces, though they are something that was assisting us in being able to pivot really quickly, as we've continued to work with the hotel spaces, it seems as if the staff or the hotel owners are not very trauma informed. And so when families or victims are having these emotional hardships, though we are trying to offer advocates as much as we can into those spaces, some of the hotels have decided that they do not want to continue to work with our agencies, with our clients, and so it is continuing to close doors and options for us to be able to support shelter services for our most vulnerable. This is something that both coalitions and myself are working for to try to mitigate these relationships, but it is something that I wanted to bring to the forefront as we are trying to continue to use hotels as a way to make sure we are sheltering people in a COVID-safe practice. However, there are some barriers that are being placed, and specifically in a rural community when we may have one or two hotel options. When one decides to no longer work with my agency, then it hinders us so much so that we only have some few options. So I wanted to make sure that that was something that was brought to the forefront as far as rural communities look on shelter services. This is something that also costs us very much. In order to secure a one room for a client, the cost is significantly more than if we had them in the shelter setting and we were able to, use grant funds to pay for those expenditures. Though our funders have been really supportive in shifting our and supporting in securing funds for hotel stays, we are in a place where those funds have become really limited. And so we are trying to make sure that we have those services available for all clients who call. But that is something that I'm identifying as in the trenches, so to say, that we are having an issue trying to figure out. So that is something that I wanted to make sure I addressed. The other thing that I did want to make sure that I had stated, which Alexandria so eloquently put, and I think it's extremely important to bring it twice to the attention, is that sexual assault service programs did not get any CARES Act funding. And so we have been using, of course, the PPP loan in order to try to mitigate some of those costs and using other resources and trying to really engage our community for funding in a time when fundraising, of course, as you've heard today, is extremely hard. It's been extremely hard for programs such as our sexual assault services to continue when we were not put in line for that CARES Act funding. So I do want to make sure that that is something that I leave with you today, that CARES Act funding for sexual assault programs is extremely critical. We did do that really quick pivot with the fundings that we were given that are normally allocated, but I think that there is a gap between that and really meeting the need of our communities, and especially in our rural communities. So I just wanted to make sure that that was of note. The last thing I did want to, well, two last things I did want to stress and communicate today is that services look a little bit different than they did before. Obviously, we have moved to a virtual platform. Again, Alexandria did state that some families are able to meet that way, some are not. But what I will say is that the time that we are spending with each family who is impacted by sexual assault, be that a child or be that an adult with children, we are spending in significantly more in-depth advocacy service time with those clients than we ever had before. I know that we have talked to you in depth about the trauma that is inflicted on an individual, but right now during a pandemic, we have the trauma that's of the abuse compounded with the trauma of a pandemic. And the idea that the basic needs of an individual are now compromised. And the idea that we have to make sure that we are emotionally dealing with the immediate crisis of the pandemic before we can even get to a place where we can think about healing of the violence that they've experienced, to even get to the place where we can start working on that generational healing so that their children will not experience the same type of abuse And so I wanted to make sure that that was of note, that our sexual assault programs throughout the state are spending significantly more time with our clients than we ever had before. A lot of emotional support, a lot of just hearing them over the phone, just spending time, just going through this pandemic, as well as the staff also going through this pandemic, as well, as you understand when I say this. And so I just wanted to make sure that that is fully noted, is that the depth and the breadth of this service that we are providing now is something that is reaching a whole new level than we ever had before. And so that is something that I wanted to make sure was a part of our conversation today. The last item that I did want to make sure that I discussed, Alexandria did bring to light PREA services, which is the Prison Rape Elimination Act, to ensure that any individual who is incarcerated, sexual assault is not a part of that sentence, and will afford those individuals advocacy, confidentially, emotional support, and some case management and resourcing as a part of that service. With COVID as a moment in time, we have seen an extreme decrease in referrals from the PREA services, and it's not due to the lack of it happening. It is actually due to a lack of communication between facilities and us. I think that there is a lot of work to be done there to continue to build that partnership, but I did want to stress that we are seeing an increase in violence for the cases that we do get, but we are seeing a decrease in the referrals that we are normally seeing by this moment in time. And again, I would like to stress it's not because it's not happening, because when we do have communications with clients who are incarcerated, survivors who are incarcerated, we do hear that there's the same amount of violence that there's always been, probably a little bit more, and in more of a harmful way, but something that is something that we are not able to make that connection towards, and something that we really need to make sure we pay attention to. So I did want to make sure that that was a part of our communication today. I believe that's all I have for this moment. And again, I will allow for questions. Thank you, Mr. Chair and the committee, for allowing me to address and speak to you today. I really do appreciate the ability to lift the survivor voices to you as you make your decisions going forward.
Thank you, Stephanie. Now, how about Angel? Are you able to get your material up? Oh, good.
Yeah, I was able to send it over to Nancy and Andrea. And so thank you so much for helping me with that. Kind of helps this time go by a little bit better. I'm a very visual person, so I appreciate having these in the background. So we're the Coalition to Stop Violence Against Native, talking all about how COVID has shifted services for our communities. So we can go to the next slide and talk a little bit about who we are. So our mission is to stop violence against Native women and children by advocating for social change in our communities. So we work with all 23 nations in the state, as well as direct service providers for both intimate partner violence and sexual violence. So we are, in a lot of ways, the sister agency for tribal people to the New Mexico Coalition of Sexual Assault Programs. We can move over to the next slide. Our focus areas are training, technical assistance, policy support, policy advocacy, and support. So we really work side by side with our tribal service providers to engage community in finding the solutions to the violence that's happening in their community by themselves. So it really is from an empowerment model or place. You can go to the next slide. One of the things that we do is support our tribal leaders. So right now, actually, we are working to prepare our tribal leadership, so governors, presidents, chairmen within New Mexico, to go to the National Department of Justice Office of Violence Against Women government to government consultation this year to talk about how sexual violence and domestic violence looks different in Indian country and what those solutions need to look like. In addition to that, we provide education and training, but really just working in partnership where we're supporting the innovation that's coming straight from the community itself. We can move over to the next slide. So we work from a place of community building. So we have some prevention programming, one of which is our Native Youth Outreach prevention education. And so we work to engage Native youth in healthy relationships, consent, setting boundaries. We actually are wrapping up today our first ever virtual Native Youth Summit, bringing together 10 youth, usually it's 40, but this cohort is one of 6. So 10 youth to really talk about and equip them with the tools necessary to become the next leaders in their community, really having the hard conversations about breaking cycles in their own families a lot of the time. We do a lot of social media engagement, and as everyone in the room knows right now, we're all virtual now. And so we operate a lot of engagement and campaign efforts around issues and topics larger as they intersect with domestic and sexual violence. So right now we have a really big push on census and voter registration, and really connecting and translating what that means for service providers. And so our community wellness and raising awareness, we're going to have to learn how to do that. Usually what we would do is go out to community and join them side by side, but that's not a possibility right now. So we're figuring out how to support in a virtual and a socially distanced, safe way our members. And then always working to center the stories, the vision and the passion of those survivors. We're really adamant about using our stories for resilience and resistance. And so right now what I'm going to do is kind of pivot and talk about what these last 6 months have been like for the coalition, and what we've seen in our tribal communities. So you can move on to the next slide. So just an overview, COVID in tribal communities. At one point, the infection rates for the entire state of New Mexico were 60% tribal people. So we know, and I'm sure you're all well aware, that McKinley County and Sandoval County had seen some of the highest infection rates, and that's a lot of their communities lie is within Sandoval itself. We have 6 pueblos, and then McKinley County is a lot of Navajo Nation land. And so how we saw our tribal leaders promote safety for folks was lockdown orders, much of which exceeded state executive orders. So there were curfews, there were actually stay-at-home orders, do not leave your house. Some are still in effect today. So as the coalition, we took on this issue to talk about sovereignty and to talk about consent and to really connect land and body consent. We work at some of the intersection between extractive industries and sexual violence, the rates of sexual violence that are increased when we know that there's extractive industries practices happening. And so we really took that as an opportunity to double down on that stance that we have as an organization. And then another really unique finding if you will, that we noticed during COVID was a lot of our tribally based victim advocates became first responders, meaning these people who would normally provide victim services to families and survivors were delivering food. We're trying to find the PPE and get it into the hands of tribal residents. And so their attention became split kind of between providing services and being a first responder. And then in a really big way, the same way that Alexandria and Stephanie have talked about, those gaps in access to some of the basic infrastructure that we know, and I'm sure a lot of you know exist, became really public and undeniable, which were gaps in access to healthcare, gaps in access to food and water, technology, and in safety. So I'll get into a little bit more of that in the next slide. So the COVID shift, kind of like where did everyone's attention go and how did it go there and what did the work look like? So a lot of advocates, both tribal and non-tribal, began working from home. And one thing that I really just want, if you remember anything from the conversation today and kind of what we're sharing with you, is so many of our advocates could go to work before and provide service and leave it at the office. Now we've asked them to bring this energy and this violence in a lot of ways into their own homes, into their own sanctuaries. And so we're holding that as coalitions in how do we support now, knowing that this shift has happened, where we no longer have sanctuaries in the same way we did before. Emergency response duties, they talked a little bit about that earlier, but we had victim advocates come into Albuquerque, we're based in Albuquerque, to pick up basic necessities from everything that everybody else was trying to find to toilet paper, to feminine hygiene products. We worked in conjunction with the other coalitions to try to source as much of this as we could find, and we're still giving it out. And so that's the personal protective equipment. In a lot of ways, we've become PPE vendors ourselves as an organization. So just kind of an interesting COVID shift for where some of us are and where some of our funding is going now, right? So none of us in our original budgets had wrote in anything for excess in toilet paper or hand sanitizer. Very early on, we were trying to track down hand sanitizer, and we could get it in these great huge buckets, but then we had to figure out, well, how then do we get these in smaller containers so that we can disperse them? And so many different ways that service providers shifted. Something that Alexandria and Stephanie talked about was shelters. So they went down in capacity. I'm sure a lot of you know this. So some of our now, like Stephanie's, who do provide dual services, are at half capacity. We know that they're not able to take in as many families, clients, survivors as they would before. Stephanie talked a little bit about the hotels. What was interesting for tribal communities is that the Pueblo of Pewaukee at Buffalo Thunder had become a place where if somebody couldn't shelter in place or they couldn't self-isolate or quarantine, they opened themselves up in a way to provide that isolation, the safe quarantining for families. You think about tribal families, we're multi-generational, and in so many ways, we could not self-isolate. We just didn't have the means to be able to shelter in place in safe, quarantined, socially distanced ways. And then folks had to figure out, in particular, shelters. If the shelter was able to put a client into a hotel, how then do they also offer client services to that person staying in the hotel? And so I'll talk a little bit more about that when I get to broadband. So thinking about food and water access, for all of kind of our tribal areas, there's something like 6 tribally based grocery stores for the size of West Virginia. And I think that statistics holds true for Navajo Nation. And so how are people supposed to access food during this time? How are people supposed to access clean water? A lot of times, especially in those really rural parts of the state of New Mexico, people are hauling their own water. And how do we designate that for hand washing when you're using it to cook with, to clean the home with? And so it just puts this immense amount of pressure on homes. And then we get down to broadband. This is probably the biggest gap that I can see and that I can think of. We met with our members the day before yesterday, and 2 could video like we're doing right now, and 10 had to call in. And so when we're chatting and we're talking, when we're connecting, there's a huge gap with how we can provide those services now that we cannot access them the same way. And although the state of New Mexico did a great job at providing and shifting to a telehealth model, that simply doesn't exist for tribal communities. The infrastructure does not exist. And so it's just become more and more apparent that broadband access is a safety issue. And we can go into the next step and to the next slide, sorry. So a little bit about advocacy and what we're asking. I echo everything that Alexandria and Stephanie talked about. So that 3.7 million ask, we're worried about what the upcoming cuts, how those are going to impact our service providers. So I think about one of our members, which is also receives funding and support from the state coalition. The Sexual Assault Services of Northwest New Mexico, since the onset of the pandemic, has served 102 clients. A lot of how they're serving them right now are the ways in which Stephanie talked about. It's expanded. It's costing our service providers a little bit more than it did before. We're having to figure out how to get these families basic PPE when they're coming to seek help. And then what was unique about tribal communities was the amount of mutual aid that happened. So there was like this groundswell of how do we keep our community safe. And that got us through the past 6 to 7 months. But what we need now is for the state of New Mexico and our federal partners to really think about securing funding so that we don't find ourselves in situations like we did this past 7 months where we're relying on community and really for the call for the service providers. Something that we had noticed very, very early on was that when the governor put out her list of these are essential service providers, shelters, folks who provided services for both the domestic violence and sexual assault weren't named. And so once we know they're essential, right? We knew these services are essential. The community really learned quickly how essential they were and are. And then with MMIW, which is Murdered and Missing Indigenous Women, the state is wrapping up their task force and will come out with findings either in October or November. I apologize for not having the dates. So I just ask that folks kind of pay attention to that and we think about what those next steps are. And then regarding missing and murdered Indigenous women, which is both the domestic violence and sexual violence issue, the state of New Mexico was issued funding for a murdered and missing Indigenous persons coordinator. They are based and housed here in New Mexico, but funding for that position is only allocated for 1 year. So I'm really concerned about what happens to that. So really this is addressing that issue of jurisdictional mazes that families encounter when someone that they love has either gone missing or is murdered. And then the infrastructure and broadband a little bit earlier, and we can kind of just know that these are safety access issues, and we've realized that in a really loud way this past 7 months. And then the last slide is my contact information. If anybody would like more information on any of these issues, we really appreciate the opportunity to sit here and talk with you and be in community, and you opening yourselves and your homes up in a really intimate way for us. We really do appreciate it, and all of the time and energy that you put in to keeping New Mexico safe. Thank you.
Anything else, Alexandria?
Mr. Chair, if you want to move to questions, we can. I mean, there's more I could share, but if you want to move to questions, we want to give time for that.
Well, we'll go ahead and go to questions then. So thank you. Thank you all for the presentation. We'll start with Senator Antoinette Cedillo Lopez.
Thank you so much for those excellent presentations. You all do such amazing work. As you know, I'm the president of Casa Fortaleza, and so we're very aware of what you all do and how important this work is. None of you spoke about getting justice for victims in the criminal justice field, and then also the CVRC, getting reimbursement. And can one of you speak a little bit about how that's going?
Yeah, sure. Good to see you, Mr. Chair, Senator Cedillo Lopez. Good to see you, and thank you for that question. So we actually in the data that just came out in our report yesterday, and as I mentioned, we are seeing a decrease in sexual assault survivors reporting to law enforcement, but an increase in those seeking help at our service providers. And looking at our statewide data, children's cases involving sexual assault have the highest outcomes in our state district courts. And in some parts of the state, we see as high as a 91% dismissal rate in one county for sexual assault cases. And so I think in context, all of that goes together, right? The most vulnerable children, where we have infrastructure around children's advocacy centers and specialized detectives in some communities, lead to better outcomes in those cases, still not high enough. But for adult survivors of sexual assault, the criminal legal system and access to justice in that way has been challenging in our state. And I think it's why we continue to want to train and educate and mentor prosecutors and law enforcement. And it's also why we should really be open to and hold the question of who is served by that system and where do we need to invest in other systems so that they can have access to justice outside of that system. And that may perhaps be restorative processes or community-based justice processes, but I think there's room for that conversation, because when I saw that 91% of dismissal, I almost fell out of my chair. How do you encourage anyone to participate in that system? The Crime Victim Reparation Commission, not only do they provide compensation for victims of crimes, they are also our pass-through funder for federal victim services as well as now state sexual assault services. And they have been a tremendous, tremendous partner during this time in helping us pivot, look at our budgets and programs being able to take money perhaps out of traveling to rural communities that they were no longer traveling to and put that directly into providing housing services or other services. And they have been working double time to get money into the state. I think the impact is that those budgets are still limited, right? Like the VOCA amounts and the VAWA amounts that come into the state, they are still fixed amounts. And without receiving any COVID-related federal CARES relief, those amounts were just being moved around within the same systems, right? And so there's a moment where now we have stood up services in such a different way that those funds have been expended. And so now that's the challenge of how to keep moving forward to create that access.
Thank you, Mr. Chair. I just a follow-up. Is there a need for a study of alternative means of receiving justice, or do you have suggestions? Or, I mean, I find it extremely frustrating to see that data year after year after year. And I find it extremely frustrating to help a woman try to get through the system, or a victim, male or female, try to get through the system and see the cases dismissed, or to see the rapist released immediately, or to, you know, it's just, it doesn't further the value of safety or the value of justice, you know, of keeping our communities safe and our victims safe, or of justice. And that frustration needs to be put to more productive use. I don't know whether, you know, giving more resources to the system has not helped at all, that I can see. So what is the answer? And so I would be very interested in what you're talking about, alternative restorative conceptions of justice, or something else, because the current system isn't working and hasn't worked for a long time.
And Mr. Chair, Senator, well, you know me, and you know I'm always willing to have that conversation, and also I think really be meaningful and thoughtful about listening to those most impacted, right? Survivors of color, with you sitting on the board at Casa Fortaleza, the survivors who have for a long time, even pre-COVID, not had access to the courthouse, to those systems. And so I think it's always a humbling reminder for me sexual violence is not situated separate from the larger issues of our society. It's actually a symptom of those larger and intersected with those larger issues. And so however we can invest in centering the needs and the voices and access for all survivors, I think is absolutely something the state should commit to. Thank you.
Thank you. Thank you, Mr. Chair. That's all I have.
Thank you, Senator Silvia Lopez. Next is Representative Gail Armstrong, and she'll be followed by Representative Deborah Armstrong.
Thank you, Mr. Chairman. And sorry, I can't do my video. For some weird reason, I couldn't get back on my iPad, but I can on my phone. So I don't know. I'm computer illiterate, so not sure what's going on. But anyway, thank you so much, Mr. Chairman and Madam Co-Chair and presenters. Alexandria and Stephanie, you guys are always such great advocates for Valencia County, Socorro County, and can't tell you enough. Thank you is just not enough. And so we appreciate you and appreciate the work you do, and don't know how you do it, but kudos to you. So I'm really concerned that there was no CARES Act money for you all, and that passed through the House and the Senate without getting that money in there. So as you know, I sit on the Legislative Finance Committee, so please let me know how I can help, and let's work ahead of time so that we make sure that this gets funded and stays funded. So I believe you both have my cell phone, and if you don't, I'm happy to share it in the chat. And please let me know. We have a meeting next week, but we need to start making sure that funding is in there as of right now. So I just wanted to make sure to tell you that, and thank you again for all the work you do.
Thank you, Representative. Representative Debbie Armstrong, to be followed by Representative Thompson.
Thank you, Mr. Chair, and thank you, panelists. One thing, Alexandria, you mentioned a new report that just came out, and I'm wondering if you can get that to the committee. I think that would be great if you can send it to Andrea and she can distribute it to us. It sounds like that would be some really good information that I would like to see. And we have heard this morning and from you all, similar to the same that we heard from behavioral health providers, of an increase in engagement because of virtual opportunities and telehealth kind of opportunities. But does that mean that I'm still trying to wrap my head around, and maybe it's still anecdotal and too early to have the data, whether there's an increase in sexual assault going on, or whether it's just it's easier to engage than it might have been in the past when there wasn't those kind of virtual opportunities, and you had to figure out childcare and getting out of the house and transportation and everything else. So I'm just wanting a sense of, has it increased? And we heard this morning from children, and I think someone might have mentioned here, an increase in maybe the severity of what kind of abuse was going on. That was noticeable. So just, Alexandria, do you, and then, or the others, have any sense or data on any of that?
Mr. Chair, Representative Armstrong, thank you so much for that question and also that analysis. I think one of the things that we saw early on in like the first 4 months was continued engagement. And so whereas we would have a drop rate of folks who were not keeping appointments, we saw more engagement, ongoing engagement. And then as stay-at-home orders began to lift, we saw an influx of survivors accessing services who had delayed access to services. So these are folks who generally during those first 4 months would have been seeking services but had delayed access to services while the stay-at-home orders were in. And today, we are seeing an increase to all of our services, including our hotline services. Actually, just last week with our providers, in most of our larger areas like Albuquerque, Santa Fe, Las Cruces, and Farmington, we are actually seeing about a third of the calls on those hotlines are domestic violence survivors who are landing at different places because, as you heard this morning, our domestic violence providers have had such an influx of calls. And so I don't know that we have the data specifically around, collected and analyzed data around new cases during this time, but we certainly saw a delay in seeking services. And the other thing that contributes to that as well is that sexual assault services tend to be longer term services because the impact of sexual assault on someone, the treatment that they are receiving for the abuse that they've experienced goes on for a longer time, right? It's not just that one crisis intervention. And so our counseling services at our sexual assault service providers are operating with wait lists from anywhere to 40 to 90 survivors waiting to get into counseling services.
Thank you. It's you would assume that with the isolation and the stay at home and so forth, that some of these issues, domestic violence, sexual assault, child abuse, increase, and maybe sexual assault because you're not out at out and about, but are at home, maybe there would be decreasing. I just don't want to make any assumptions just because there's more engagement because you have a new method of engaging. And so I think it's important for us to parse that out. I mean, I assume that the need is higher, but definitely the engagement is higher. And I think someone mentioned, and I would assume some of these new mechanisms of engaging need to stay around post-COVID. I think we've learned from behavioral health to domestic violence, sexual assault, that not everyone can easily get out and access, and may be actually more comfortable in speaking with someone that's in this kind of environment instead of coming in. So I think kudos to all of you in being creative and developing new opportunities and ways of serving. And you know, I hope we learn the best lessons of that and keep around what's useful to keep around to increase that engagement. And it won't be for everyone, and certainly in-person services are needed on a whole variety of things, but to have this tool is important. But thank you, panelists, and I think as we go on, I know it's probably is too early for the data and to really do that kind of analysis, but it is something I think that by this time next year or whatever, where you're looking at a whole year's worth of data and can compare it to previous years, what kind of increase we see and in the need. And I just don't want to necessarily jump to conclusions one way or another about increased incidence. I don't want to dismiss it and just say people are accessing that wouldn't have, and it's just the same out there, or that it's gotten way worse. I don't know. I don't know that we know. So just throwing that out there, that, the more we can kind of tease out what differences there are because of the isolation and over COVID would be good to know. So thank you so much for your presentation. I appreciate all the work that you all are doing. This is really hard. It's hard work, and it's hard on everyone in a whole new environment of the pandemic. But thank you. Thank you, Mr. Chair.
Thank you, Representative. Next is Representative Thompson.
Thank you, Mr. Chair, and thank you again to all the presenters. You've done a great job, and you always do a great job. So I think in 2019, we passed and got signed a sexual assault survivor, survivor's Bill of Rights. And I'm just curious, have you seen any difference with that? Has that made any difference? Does it need to be tweaked? Anything you can report on that?
Mr. Chair, Representative Thompson, good to see you. I paused for a moment just to see if Angel or Stephanie had an answer for that. I will say that we have seen a major use of the Survivor's Bill of Rights as it directly relates to the sexual assault backlog, the KIT backlog, which was a part of one of the reasons why that legislation was passed. And so that has provided it has provided measures as we've structured what that process will look like for survivors as they move through the process. And as I mentioned, it's included in the new KIT tracking initiative that was just launched by DPS. And so it has created access for what survivors, for how survivors access their information. I think that there is still use of training and really getting folks to understand what that Survivor's Bill of Rights means. But I think if we need additional changes, we will certainly let you know as we hear from survivors and our providers. And I see Stephanie shaking her head, so I don't know if you have more to add to that.
Mr. Chair and committee members, yes, I agree with Alexandria. Because this is something that was recently passed and it is new to the state, there is some training that needs to be initiated with our partners in order to continue to make sure that those are utilized appropriately and effectively for victims. So I think to answer your question, I think we need a little bit more time and more training for our partners.
Okay, thank you for that. And thank you, Mr. Chair. And just, I know that when we worked on that bill, we gave a little bit in terms of the timeline of how long it would take to process a kit. And I'm wondering, do we need to, and I won't say the agreement, in my mind, it was an agreement anyway, that at some point we would come back in and make that timeline even less as the state lab kind of got up to speed. Are we there yet where we need to cut that timeline?
Mr. Chair, Representative Thompson, the update that I have from our sexual assault nurse coordinator here at the coalition is that the backlog, as we had talked about for years and years, has been processed. There's now rolling levels of implementation. And so this sexual assault tracking kit was one of the key pieces of being able to tell how long kits may sit for before they're sent off. And so I think once that's been implemented, and I'll talk to the partners that have been leading on this, but I think once that's been implemented, that will give us a true measure of how long it's now taking for kits to be sent to the lab. And then I think you're spot on. We'll need to look at whether it's time to shorten that time frame.
Okay, perfect. Thank you.
Yeah.
And then this is in terms of I know someone who was a victim of childhood sexual assault, and both of her parents are in jail. And but she's having some issues now. Is there a statute of limitations? I don't know what the right word is in terms of the crime victims reparation. Is there a time period of which they can take advantage of what services that might be?
Mr. Chair and committee members, no, with our experience with working with the Crime Victims Reparation Commission, the individual would just have to work with a service provider or contact them directly and let them know that, they did not have prior knowledge of these services at the time of the occurrence, and that they are experiencing some trauma echoes as a result of the trauma now in their later life. And then they will be able to access those supportive fundings for counseling or however they need to be addressed per the survivor's decision. So no, they just would need to explain why there was they didn't know about it prior.
Okay, all right, that's all I had. Thank you so much for the answers, and thank you, Mr. Chair.
Thank you, Representative Thompson. Is there anybody else on the committee with questions or comments? I've got a couple of my own, so I'll jump in. If you have something, just put your hand icon up. First, for Alexandria, I guess both of these are for you. I think you heard this morning's presentation, and you heard probably Senator Lopez questioning the lack of training that she felt police investigators of sexual abuse of kids were prepared with. And I wonder, I noticed one of the things that you do is train law enforcement. Have you been able to become involved in the preparation of law enforcement, state police specifically, I guess, or of any local law enforcement as well, with your training program?
Mr. Chair, thank you for that question. And you may not remember, one of my position prior to being at the coalition was actually the ED at Valencia Shelter Services, where Stephanie is now the ED. And I started the Children's Advocacy Center in Valencia County during that time. we do provide a lot of training for law enforcement. I think one of the issues in New Mexico around training, right, because all training has its limitations, is that a lot of our police departments do not have specialized units. I know Carrie Lee mentioned that in her county, they do actually have a specialized unit devoted to the investigation of child abuse. But for many of our communities, in Valencia County, we coordinated 6 law enforcement agencies, and not one of them had a specialized unit. So you're often training detectives, and in some instances, some departments even have line officers responding to these calls and investigating these calls. You have turnover, and you have people who are first assigned to a case but then do not carry out the case. And so through the Children's Advocacy Centers, through the coalition, we're committed to always bringing in the best, most culturally relevant and evidence-based training that we can from our national partners. But some of the retention issues and the resource allocation issues in our departments where we don't have truly these specialized units, I think really limit or create barriers to the training that's provided.
Mm-hmm. Yeah, I can see where that would be a dilemma. I guess I'm also concerned that the report is made to law enforcement, and that's appropriate under the Children's Code, but that the agency with all the services is CYFD, and they do try to coordinate at the local level. But it seems to me that in a lot of these cases, if the investigation were being done primarily by the social worker from CYFD, it might be easier for the child to be forthcoming and not to be as traumatized. What do you think of that?
Mr. Chair, I think your thinking is right on, and I think that that's the essential function of our children's advocacy centers in our state. And Stephanie is the director of a children's advocacy center, so I can also have her answer this. But I think that that is the essential function of the children's advocacy centers. And so how all of the system players come together to utilize the resources that exist in the community and work through those children's advocacy centers, I think that is the key, is to getting folks to actually utilize those services, how they are intended to be utilized.
Did you want to add anything, Stephanie?
Yes, thank you, Mr. Chair and the committee members. To add to that is that what I'm seeing is that when we can come together and actually work cases alongside our law enforcement partners and those of CYFD, I am seeing a better outcome in those cases, because we can support with training time, and we can support with those best practices when dealing with clients, but I will also say it's that and. The other and part means walking a specific case that we may be working together to implement the training in a real life practice. And I feel like when we can do that with law enforcement, then that gives really great results that they are able to take. I do want to echo what Alexandria did say, specifically in Valencia County and surrounding areas that we provide services for. We do not have specialized units of law enforcement officers that are specifically dedicated to this case. And so we will have law enforcement officers who are also working robbery cases, and then the next case they get may be a sexual assault. And so how challenging that is for rural communities and our law enforcement to kind of switch gears in that manner when we're working with these very intimate traumas and violence. Those are things that we experience. And, try to also support the system as in our advocacy, not just the client too as well. And I do believe that the working cases alongside our partners is where we find the best application of what we've trained.
Good. Okay. Well, finally, I just had a request of you, Alexandria. You mentioned possible legislation that you all are considering. I don't know if you're interested in seeking the endorsement of this committee for any of those pieces, but whoever the sponsor is should be in contact with Andrea, our committee attorney, so that we have plenty of lead time in preparing that. If you're seeking endorsement, the endorsements will be done on November 12th. People don't always want endorsements from the committee. It limits a couple of ways. One, you lose the endorsement as soon as the bill is amended. But two, it gives any opposition out there plenty of time to fully arm themselves with the arguments and the whatever ammunition they need to send it spiraling into defeat. So, but I offer that. It does help sometimes, and it's certainly a way of educating a large number of legislators in one place. Well, thank you all. Thank you, Angel and Stephanie and Alexandria, for a very fascinating presentation. We appreciate the information. And members, I tried to chat all of you up with this next thing. I'm going to add something to the agenda right now. Andrea sent out minutes of the September 16th meeting, and I was hoping you'd have a chance to read through them. That was a meeting last week, just a little over a week ago. And I'd like to adopt them now because we did establish a quorum this morning. Before we do that, there are two amendments I'd like to propose to them. Both of them are on page 2. And the first one that I propose is under the questions and comments from committee members. I found that first one there somewhat confusing. It reads now, there is a mental health pandemic related to behavioral health counselors who struggle to receive licensure reciprocity through COVID-19 measures. I think I remember what we were getting at there, but I thought it might be captured better. But I'm certainly open for discussion on it. If we changed it to read just two simple changes, there is a mental health pandemic related to COVID-19. And then a new sentence, many behavioral health counselors in Strike Who struggle to receive licensure reciprocity through COVID-19 measures. I just think that captures it better. The other one I'd like to propose is at the very bottom of the page where we talk about who made the presentation on healthcare professional licensing. It wasn't Marguerite Salazar. She was scheduled to do it, but she didn't come. And I'll be darned if I can remember the name of the gentleman who took her place. But I think basically it was Linda Trujillo who did it.
Mr. Chair, it was John Blair.
John Blair, that's right. Very good. Very good. So if we could substitute John Blair for Marguerite Salazar and Strike Superintendent. I think John is the division director.
Right. He's the director of boards and commissions.
Okay.
And Mr. Chair,
I'll make
I
those
have
changes.
I have two additional changes, I think. Members can confirm, but I had on my checkoff list for attendance that at least for a portion of the day or when we were introducing, Representative Gail Armstrong and Representative Wanda Johnson were both in attendance.
Yes, they were. Briefly, but they were.
Yep.
I thought, well, it's hard to remember because I thought Phelps Anderson asked one of his questions that day too, but I can't quite remember.
I can't quite remember either, but of particular importance, well, it's important on all of them. I wasn't looking at the advisory so much as particularly for a quorum, the voting members.
Yes.
But I do think both of those representatives were present.
Yes, I think you're right. Were there any other changes, Representative?
Not that I had, thank you.
Anybody else have any other changes or amendments they'd like to make? Additions? Very good. I just want to say how impressive it is that we got these out so fast. So thank you very much, Sabina. This was very good. And we still don't have the minutes from the previous meeting, which was, what date was that, the 4th? Or? I think the previous
Correct,
meeting.
September 4th.
September 4th.
September 4th, Mr. Chair.
But we'll get to them whenever they are ready. So for now, I'd like to take a vote on this. I'll move the adoption of these minutes as amended.
Second.
And if you could call the roll of the voting members, Andy, then we'll see if there's any opposition.
Sure. Representative Gail Armstrong.
Yes.
Okay. Representative Joanne Ferrari.
Yes.
She may have stepped away for a minute.
No, she said yes.
She said yes.
Oh, she did. Oh,
And
okay. I
this
didn't.
is for the minutes?
Yes.
Okay,
Yes.
thank you. Okay.
Sure. And then Wanda Johnson.
She was on this morning, but was having connectivity problems.
Yeah. Okay. And then let's see. Representative O'Neill is not here to my knowledge, nor is Senator Purtle. So that leaves Co-Chair Armstrong and you, Mr. Chair.
Yes,
So-
for me.
And yes.
Yeah.
So we have a unanimous vote on the adoption of the minutes. And with that, we'll move to the final panel on our afternoon, which is combating human trafficking. And first, let me double check. Do we have all the presenters here yet? We're a half hour ahead of schedule.
Well,
Mr. Chair, they should be on there except for Frank Zubia, which I, for some reason, cannot make him a panelist.
Okay. Okay.
and Mr. Chair, may I start the presentation?
Yes. Why don't you begin the presentation, Susan? Thank you.
Thank you. Thank you, Mr. Chair, and members of the committee and Madam Co-Chair. Thank you for asking and for being interested in this subject. I wanted to give a little bit of history of this subject and what New Mexico has done about it. In 2008, you passed a statute defining human trafficking as a crime. The statute included services for victims at the instigation of many community advocacy groups. There was also a provision for an ongoing task force. And then in 2009, the Attorney General's office convened a conference of law enforcement with presentations about domestic minor sex trafficking, including presentations from Arizona, Texas, and Washington, D.C. And an ongoing task force was convened by the Attorney General's office, which included representatives of community groups as well as law enforcement. And then in 2014, there was a memorial sponsored by Representative Chasey, and a task force was formed to study delivery of services to sexually exploited minors. Some of the recommendations from that task force I wanted to share with you. What we talked about were services available to at-risk minors when they come into the system, and that means at the moment that they come into the system. That the services should be offered repeatedly to each individual, and that's because a lot of times it takes a while for them to decide they want to make a change or that they are in need of change. And so they need to have the services offered again and again. ongoing training of officials, providers, and advocates who might encounter minors involved in prostitution. No court-mandated rehabilitative services. That's what we were against is the mandated part. Screening rather than sweeps for sexually exploited minors. Funding for services, and sensitivity to LGBT issues. And in all of this, the emphasis was on the immediate availability of services because of the danger that the victims are in, and because of the fact that it may just be one thing or a small thing that they need in order to make a change, in order to get out of that danger. But we wanted that to be available to them right away. And so then several years ago, we started asking for funding for services specifically for human trafficking victims of any age. And those services started to be available. The funding was available through Crime Victims Reparation. And they set up a system so that the services could be available throughout the state. I see that Frank Zubia has been able to join the meeting, and I'm not sure who to go to next either. But I want to turn it over to someone else in the who's speaking for the group. So,
hi, if possible, I would like to go next. Mr. Chair, members of the committee, thank you so much for having us. My name is Michael DiBernardi. I'm CEO of the LifeLink, and we've been doing the human trafficking work for over a decade now. And I wanted to just give kind of an overview of where we are with federal funding around it so that you have an understanding. A similar, but maybe slightly different version of history than Susan provided. So, but coming from the LifeLink's perspective, in 2009, we were approached by the Attorney General's office to assist in an awareness campaign that they were doing around human trafficking. And Lynn Sanchez, our program director, was approached to say, well, if we start identifying these victims, how are we going to help? And Lynn with the LifeLink and said, well, we'll start working with you. So that really created the initial partnership. And there's a lot that's happened since then that I'll let others speak about. In 2015, the LifeLink, along with the Attorney General's office, was awarded an enhanced collaborative model grant through Department of Justice that was really designed to create a framework, set up funding for creating a task force. I know there had been different task forces in the state prior to that, but this was the DOJ funded one. And so the ideas of the task force were to help increase awareness and outreach to victims in the community, to bring more service providers into the work, because we know in general New Mexico has a real deficit in mental health services, and we needed more, to enhance the partnership and the collaboration between service providers and law enforcement, and to really create a coordinated response to human trafficking in New Mexico. And so over the past 5 or so years, that's what we've been doing. And in that time, we've done dozens, if not hundreds, of trainings for all types of groups, from law enforcement to community members to businesses to you name it. In 2018, then, so that first grant cycle was 3 years. In 2018, we again were awarded another grant, LifeLink and the Attorney General's office, for a second phase of implementation of a task force. LifeLink at that time also received a comprehensive services grant. So really what that amounted to, that from the LifeLink's perspective, is we got approximately $1.75 million to really continue, some of it to continue with the task force activity, but more to do with providing services to the survivors. And I know Lynn's going to talk about some of those numbers, but since that 2018 grant, the last 2 years, the LifeLink has served over 200 survivors. And it's important to know that the victims often arrive with absolutely nothing. They're brought to us by law enforcement, and we need to get them an emergency shelter, support them through transitional and permanent supported housing, get them the basics for living, mental health services, healthcare services. Really, they need everything. So that's how we have been using that funding. we have seen really exponential growth since 2009, so the last decade. The more awareness that has happened, the more victims that have been identified and referred for services, and we are very quickly spending through that money that we have. So we have one more year of funding on that. What we've been told by sources at the Department of Justice, or OVC, is that they're cutting funding to grant programs. And so there's not much likelihood of additional extension of funding or additional grant around this. Trust me, we're doing everything we can to identify every funding source, but really in less than a year, it's potential that with the increased identification of survivors in this state and no funding to provide those services, we're going to be hitting a real crisis with this population like we are with everyone else. So I just kind of wanted to let you know where the state of services are. And we do have, we certainly have partners in the state providing the services, and I know others are going to talk about them, but I just wanted to provide that overview. And again, thank you all for giving us the opportunity to discuss it.
Before we go to the next presenter, just to follow up quickly on your point, which other agencies in the state receive the Department of Justice funding that will be lost?
Mr. Chair, the only other agency in the state, to my knowledge, is First Nations in Albuquerque is receiving Department of Justice funding for human trafficking. We do have other partners who work through other funding sources. Street Safe in Albuquerque does a lot of outreach work around this population, and other agencies in Albuquerque. But the DOJ is us and First Nations.
But their funding isn't threatened the way these DOJ funded programs are facing.
Mr. Chair, I would have to have them speak to that. I think they're mainly getting funding outside of First Nations from, just donors or state funding, CVRC. Frank will talk about some of that. But the vast majority of funding coming into the state for victims of human trafficking is through Department of Justice.
Okay, good. So who goes next? Lynn? Who's the next presenter? Is it Lynn?
I believe it's Anthony with the AG's office.
Anthony? Okay. Are you there, Anthony?
Mr. Chair, a member of the committees, if he's not here, then I'll go ahead. He'll be on shortly. I think maybe he didn't realize it started early. I just wanted to recap. Can you hear me?
Yes.
Is he here? Is he on now, or was that somebody else? Okay, so I wanted to recap about our human trafficking hotline that was passed into legislation in 2013, which created a statewide response to victims of human trafficking. It has been receiving, for example, in the last year, it was 639 incoming calls and 270 texts, 662 different callers and individuals. So I think that the hotline has become very successful in terms of really being a good source of resources, information, and connection for victims of trafficking. Part of what we're going to be doing is partnering with Seattle Against Slavery. They have a program called Freedom Signal, and they're going to be rolling our hotline number into their very high-tech program, which is developed by Microsoft and Google and all of those big executives. So we're excited about that. We'll keep our number, but it will run through their platform. And the really exciting thing about that is we're going to be able to do statewide outreach for victims of human trafficking on the web with that program, because we are such a rural state. It will be a very effective way of reaching victims while they're being posted online, while they're being trafficked. So we're excited about that. The other thing I wanted to talk about was our primary partners, our New Mexico Dream Center. And then we have First Nations and Street Safe. And there are some other providers around the state that primarily work with homelessness or domestic violence, sexual assault, things like that, who are also identifying survivors of trafficking, but their numbers aren't included in the ones that you see in the handout. So, for example, we reported that our primary partners, these 3 that we mentioned, had served about 526 victims in the last year. 400 of those were outreach, and those are very limited services that those survivors received. And I think that's really important to highlight for you, just so you can understand that. I think that's just the tip of the iceberg. And those are numbers that we don't have the capacity to support in our state. Obviously, if there's no way we could provide the long-term comprehensive services that a survivor needs to that many survivors in a year, the way things are right now. So also our services have really expanded during the COVID pandemic. We've been able to, especially utilizing our partnership with crime victims, we've been able to quickly get somebody off the street or out of a situation into a safe hotel, Uber them to a safe house, start working with them online with telemed and other types of therapy and counseling sessions and things like that. So we're pretty excited about, moving forward with that work, with these changes. But again, like I said, I think that for everybody who's trying to work with a survivor, the number one thing is you have to immediately get them to safety. And that requires, safe houses, which we've kind of changed a little bit through the pandemic to go back to utilizing hotel rooms, because then we're only putting one person at risk instead of putting them around each other. And then also the safe houses that we do run, we're very, careful with in terms of, having people quarantine there for a period of time. Another thing that's really come up out of the pandemic is the need for services for youth. And I know Susan kind of opened with that was the primary task of our task force and our state efforts from the very beginning, way back in 2008, 2009. And we're seeing a lot of 16 to 21-year-olds who have aged out of the system. They're no longer in CYFD care or custody. They're on the streets, they're on the run. They might have a placement worker who, I have a lot of respect for all of the placement workers. They have about 80 kids on their caseload statewide. And then they have very limited resources with which to connect them. So we've worked with several of these youth throughout the pandemic, and I can tell you they're a very difficult population to work with, just due to their level of trauma and the sexual trauma they've been through, and then just their lack of faith in the system, and that anybody even believe that no one really cares about them. Right now, our state is looking at a case of a 14-year-old who, because we don't have services in our state, CYFD is considering sending her away to Kentucky to a residential treatment center for 3 years. Now, that's the rest of her childhood, and it's unacceptable to us as a task force and just members of, the community. So our goal is, obviously, we want to try to create some sort of system where we can have real treatment, trauma-informed treatment for survivors of trafficking, and to really embrace our youth and let them know we care about them, and not have to re-traumatize them through displacement by sending them away to another state, away from the only family and community that they know. And that's all I have for now. I think Anthony is on now, so I'm going to turn it over to him.
Good afternoon, everyone.
Good afternoon, Anthony.
Sorry for the delay. I was trying to put on a nice suit. I was wearing a t-shirt, so. Thank you for having us this afternoon, and I wish I had the opportunity to actually be in the same room with all of you. I actually miss driving up to Santa Fe and doing that. So, as you all know, I'm the special agent in charge and the commander of the Internet Crimes Against Children and Human Trafficking Task Force for the Office of the New Mexico Attorney General. I have been with the Attorney General's office now going close to 12 years. I've been in law enforcement 32 years. I oversee a task force on the Internet Crimes Against Children side that's it's 89 agencies made up of federal, state, local, military, and tribal agencies. And as the regional task force, I oversee the task force, and we receive tips from the National Center for Missing and Exploited Children and the public every single day. And with those 89 agencies, in addition to our team at the Attorney General's office, I'll assign those tips. And I'll talk a little bit about those tips in a moment and what we're actually seeing. In 2015, the Attorney General asked for us to look at starting a human trafficking task force. We were working human trafficking investigations dealing with children on the Internet Crimes Against Children side of the house, but we were working with the adults, but we really didn't have a lot of resources available. So we started the Human Trafficking Task Force in 2015 with our collaborative partner, the LifeLink. Lynn Sanchez and I are co-chairs of that task force. In that task force, many of the same law enforcement folks that work on the ICAC side also work the human trafficking side as well. And so one of my responsibilities is to make sure that the entire state is trained, all law enforcement, on Internet Crimes Against Children and human trafficking. So as the regional task force, we received tips from the National Center for Missing and Exploited Children, the National Human Trafficking Hotline, and referrals from the public, in addition to tips from the community. And unfortunately, we get quite a few for a state our size. And I know most of you have a handout that we created for you, and I wanted to show you. So on bullet point number 3, or bullet point 3, I listed there during the time frame of August 2019 through August 2020. One of my requirements with both grants is I keep track of all the tips that we bring in, of course, the assignment of them, and how they progress through the investigation. So just during that time period, we saw an increase, and we had 2,199 tips. Now, that's a lot for a state our size, 2,100 tips. And out of those tips, we saw over 111 children that were being enticed by adults that had potential to be trafficked. Those enticements included grooming, trying to get the child to meet somewhere, trying to get the child to just leave their home, and things like that. 14 adults actually planned to meet children. And then 7 of those tips involved child prostitution. And then the remainder of the tips involved manufacture of child pornography, distribution of pornography, and also possession of pornography in our state. So those numbers are very alarming, considering when I started the task force, about 12 years ago, I was seeing an average of about 10 tips a month. And we saw a huge increase over the last couple of years, specifically during the pandemic, when all the children were sent home to school from home. We saw an increase then. So we were seeing an average of 100 tips a month, and they went up to about 200 a month. So definitely an increase, because more children had access to devices and those kind of things. And definitely a concern for us, because those children are being enticed. Now, I also receive the tips from the National Human Trafficking Hotline. And again, we have a collaborative partnership with the LifeLink. They have a hotline as well, a resource line that we receive tips from. I also receive tips from the Children, Youth, and Family Department. A couple of years ago, I worked with them to develop a protocol, so when their investigators go out on an investigation, they know what to look for to try to determine if a child is in fact being trafficked in their home. So I received tips from them as well. So on an average, just during that 1 year period, we saw 296 tips. And these are, of course, separate from the National Center tips from the National Human Trafficking Hotline, CYFD, and then, of course, referrals, and then from the LifeLink. So again, we're seeing a huge increase of tips across across our state. And on an average that I look at alone and that I sign out to either my team within the Attorney General's office, or if we sign them out to an affiliate, we're looking at about 200 tips plus a month. And again, with the increase during the pandemic. Definitely a concern. We were able to receive some funding through the CVRC to place a victim advocate. She has quite a bit of experience down in our Las Cruces office. Since we saw, we do have about a fourth of the traffic coming from the southern part of the state. So we have a victim advocate down there that works with both human trafficking and ICAC. But of course, she coordinates all her efforts and she works directly with the LifeLink, who is our collaborative partner. So we have seen a considerable increase. And that being said, what we've done to take care of that is that we're really working on educating the public. It's something that we do almost on a weekly basis. And just to give you an example, I've been training medical personnel throughout the state for the last couple of years. I've trained UNM Regional and I trained Presbyterian. Before the pandemic, I was supposed to go down south again and work with all the hospitals down there and training their medical staff on what to look for if they come across a victim of human trafficking. In addition, we train paramedics, law enforcement, of course, victim services folks, and anyone that may come in contact with the victim. And then most with the trucking industry, since we know a lot of the victims, especially the child victims, are being taken to the truck stops and being approached by truck drivers, or they're approaching truck drivers, and solicitation is taking place. So we're training the truck drivers on what to look for and how to report it to us. Just to give you an example of one of the things that we're doing next month, we're doing a presentation with the oil and gas industry on how they can help us identify these victims of human trafficking and how they would report. So with our collaborative partner, the LifeLink, the Attorney General's office has trained pretty much every profession throughout the state, and then also doing the community outreaches as well. So definitely getting the word out. Now, I apologize for my tardiness, but one of the biggest concerns that I've seen, and again, being a law enforcement for 32 years, and now really focusing in this area for the last 12 years, is the lack of services for our children throughout the state. It's been a concern for quite some time. I know Lynn and I have both worked with various groups throughout the state. We've tried to get as many service providers out there involved, but unfortunately, we're just not seeing the services we need for our state. In fact, we've been in a position where we've actually had to send some of our children here in New Mexico to another state to receive services and help because we just weren't able to provide that here. So that's been a big concern of mine. And I know of the LifeLink as well. Lynn and I have discussed that numerous times, and we've met with CYFD, and you know we're still working very hard to get that accomplished. So one of the things that also, and I'm sorry, I probably, and I apologize. Usually I'm used to looking at everyone's faces and if there's any questions, and I actually talk really fast. It's being a cop for as long as I've been. Does anyone have any questions so far that I can clarify?
You know what, Anthony, we're going to hold the questions till all the presenters have presented. And I would love to see your suit. You know, we never did see you. If you went to all the trouble to put a nice suit on, we would love to see that. But we're going to hold the questions for till after all the panelists have spoken.
And unfortunately, I can't see myself here, so I don't know why on this particular program. So I don't know if you were looking at my nose, my forehead, or just anything. So are you seeing a suit now? Okay. Thank you. So thank you. And again, I've been doing this for years, and I love to be in front of you in person. Also with me today, Mark Roscoe. He's the Assistant Attorney General in our Special Prosecutors Division. Mark is going to provide a brief overview of the human trafficking legislation for the 2021 legislation session. Mark, are you on?
Yes, Anthony. And it's too bad I can't see you because I was really hoping that we were matching ties so that everyone would know that we are coming from the same office at the Attorney General's office. But you'll have to send me a picture of a selfie or something later. That way we can see how it matches up. Chairman and members of this committee, thank you for giving me an opportunity to speak a little bit about a bill that our office worked on in the last session. That was HB 237. The reason why I'm discussing it in front of this committee, Honorable Chairman, is more because I think it provides a helpful prism for some of the challenges that especially prosecutors and indirectly victims have been confronted with now that the human trafficking statute, which was enacted in 2008, has been experiencing some growing pains in terms of identifying some of the areas that can be improved through legislation. With that in mind, HB 237 attempted to basically adopt all of the feedback that we've received from victims of this crime over a period of time, all of the direct interactions with victims, survivors of this crime, where they've informed us, what are the obstacles to them getting agency back over their lives. The approach of the Attorney General's office in any criminal case where you have a victim of human trafficking, which is codified under 30-52-1, this is fundamentally a crime about exploitation, but also it is a crime where someone's agency over their own lives, over what they're going to do for a living, who they're going to love or have intimate relations with, where they're going to be lived, is fundamentally undermined. And that is one of the most critical protections that the law can provide for people. In terms of why it is important, why it is that the law matters in this area, I've had the opportunity, and just to, I need to provide my job title, everyone, so I'm not just a guy wearing a suit who has a tie that does not match Anthony Mays. But I am a Special Assistant Attorney General at the Attorney General's office. I do prosecute human trafficking crimes, but more importantly, I'm also involved in training of other prosecutors regarding the different components of our statute and how it can be used to best protect survivors and give them agency over their lives. And the thing that has come up persistently whenever I've been involved in trainings, especially this year, is looking back through the history of our state, the history of our territory, to see the fundamental importance that the law had. New Mexico has the ignominious distinction of one of the first federal statutes that actually uses the term New Mexico outside of the organic acts when our state was a territory. Was in 1867 after the 13th Amendment was enacted, and it was the Anti-Peonage Act of 1867 and prohibiting peonage in the territory of New Mexico. Some of the earliest Supreme Court decisions from our territorial history actually involved whether the status of being a peon, so a person who is forced to compulsory service of a debt, could be transmitted without notice to the child of the peon. That case is Jaramillo v. Romero. The site for that is 1857 NMSC 007 at paragraph 20. Those are dark origins, and the reason why I'm even bringing it up in the first place, bringing up the fact that during our territorial history at least, there were statutes that reduced the civic position of Black people in our state, for example. That was, and I'm going to use a euphemism because the title is, it's just no good. Act Concerning Free Black People is the term that I'm going to use, of 1857 actually reduced the status of Black people in our state. The reason why that history matters is because I think it exemplifies the importance of the law in codifying certain norms and the treatments of survivors of this crime. And so with that in mind, the work really got started in December of last year when Searchlight New Mexico published the article regarding a sex trafficking survivor from the Navajo Nation who fell into one of these gaps between federal enforcement, under Chapter 77 of the federal statutes that deal with human trafficking and voluntary servitude, and the state statute. So one of the first fixes that was proposed in HB 237 to resolve this specific issue was adding verbs like harboring, providing, maintaining, and patronizing to the list of prohibited verbs, where if someone is compelling a person to service or to commercial sex, or to labor, that we match at a minimum the language from the Trafficking Victims Protection Act, which is the federal statute, so that in the future, whenever we're dealing with survivors of this crime, that perpetrators of this abuse don't fall within the gap of a verb. And also to make sure that the verb that is used and presented to a jury actually reflects the seriousness of the crime. To give this committee an example, if someone were to go to a minor for purposes of compelling commercial sex from that minor, the closest verb that fits in the existing statute of 30-52-1 is solicit. Now, what's the problem with the verb solicit, especially when you're framing those types of cases for a jury? Well, solicitation for a crime implies some sort of agency in the other party, some sort of union of purpose or potential union of purpose, almost a complicity. And that's completely inappropriate, especially when we as prosecutors or really attorneys in any proceeding that involves juries are trying to inform them that, no, this is patronization. This is a one-sided relationship where a child is being forced into this world of commercial sex and lacking the wherewithal to handle that situation. And so those verbs were not just adopted absent-mindedly from the TVPA. It was with the purpose of filling in that gap and also making sure that, for example, the term harboring, that in the context of labor trafficking cases, when someone is taking advantage of, let's say, and I'm just going to provide a hypothetical, of migrant labor, and they are sealing away and isolating a person, that there is a verb in the human trafficking statute that can reflect that conduct so that when we are presenting these cases, we can do so successfully. Another component of HB 237 that resolved some issues that we have now is for purposes of the notifications of crime, notification of victims of crime act, human trafficking is not one of those statutes. A person could be compelled to service through force, fraud, and coercion, and NAVA does not apply to them, where a prosecutor in our state will be able to argue for the additional protections of it. Now, why does that matter above the common sense level? Well, take, for example, crimes that involve intimate relations between involving children, adults, anyone that is covered by the human trafficking statute. NAVA can be argued, and the constitutional protections of the Victims' Rights Act can be used affirmatively in protective orders during litigation to help reduce the trauma and re-traumatization that victims face. That's why that is such an essential provision in our view, which is why we worked with the sponsors to ensure that that was in HB 237. Another component of it was expanding the safe harbor language in 30-52-1. The threat that the criminal justice system could be used as a weapon or instrumentality of abuse of a person who I am compelling into a world of commercial sex. If you go to the police, you will be arrested. And that being a mechanism of coercion against a person was completely unacceptable to us, which is why we proposed expanding a safe harbor so that human trafficking victims cannot be so threatened by their trafficker, by the person who's abusing them. The law matters, the terms that we use matters, and we feel that that was a positive direction that could be taken. Another component of it was increasing the basic sentence for this crime. You know, many of us on this presentation are lawyers. We hear the traditional reasons that justify criminal sentences and whether it should be one penalty or another. We hear about incapacitation, specific deterrence, general deterrence, rehabilitation of the offender. What was so important about the increase of basic sentence in HB 237 was the restorative effect of that penalty for the victims of this crime, of securing their truthful cooperation in cases, because we've now reached the point where many of these offenders are released and these victims are terrified about the fact that these folks are being released. And they are terrified ex ante, so before they've cooperated on a case to end the trafficking activity of the person that abuses them, they're concerned, especially in the adult cases, that it is a 3-year penalty. To give this committee an illustrative example that I think it shows a counterintuitive application of the law, but earlier this year I was involved in a probation violation setting for a human trafficker where he had served his little 3-year sentence that, by the way, was mostly eaten up by pre-sentence confinement time. And the offense that after he let his GPS unit die, after he entered the exclusion zone that he wasn't allowed to be in, the jurisdiction that permitted a court to protect the victim of that crime was the fact that it was the second time that he had trafficked in a controlled substance. The reason why that is counterintuitive and almost perverse is because he was facing an 18-year sentence for a second time distribution of a thing, but yet the 3-year sentence for trafficking of a human being that is not a thing, a human being that has hopes, aspirations, dreams for themselves, and at this point in victims' lives, some control over their life where they're not under the thumb of a person that has committed them to a position, reduced them, to a position of involuntary servitude. And so that was the thought behind that provision of it. We also, one of the issues that potentially comes up that has been litigated in federal court, but has not been litigated in the state of New Mexico, is whether the protections of our Rule of Evidence 412 that protects the sexual history of a victim of crimes that involve sex, whether that applies for commercial sex victims, whether the state can affirmatively seek to protect that history so that a trial is based off the relevant conduct of trafficking and that abusive conduct versus a circus of the victim's sexual history, history of performing sex work, etc. And that was a codification of every federal circuit that has addressed this issue, that the federal rule that's substantially similar to our Rule of Evidence has resolved. But what we were seeking for in this more victim-centered approach to how this is treated criminally in the state of New Mexico is ensuring that rather than rolling the dice on litigation, that victims at the outset will know that the case is going to be about their trafficker versus what it is that that victim had to do to survive prior to interacting with their trafficker. Another example that comes up frequently, especially in the context of labor trafficking, is the fact that we do have a racketeering statute in the state of New Mexico, but unlike the federal statute, trafficking is not a part of it. And so in terms of being able to address criminal enterprises where coordinated activities are resulting in New Mexicans or people that are brought to New Mexico being forced to engage in labor or commercial sex, we wanted to fix that specific issue with that racketeering statute. Another component, and I apologize, Mr. Chair, for this sounding a little bit like a litany, but I do want to make sure that I'm specifically identifying some of the weaknesses and gaps that can be addressed to help better not just improve the possibility of victims being able to have some agency through the criminal justice system, of being able to tell their truth to a jury and hold the perpetrator of that abuse accountable, not just of increasing the likelihood that a victim will then be entitled to restitution for the harms that they've received. And so that's the reason why I'm going in such a detail regarding these specific points. But we also looked to ensure that whenever someone uses force against a victim, that a court has an option under the Meritorious Deductions Act to consider the unlawful use of force against a victim for purposes of the meritorious deductions, because at this point it's 50% rather than the 85% that's provided for most violent crimes. The reason why that's significant from the point of view of survivors of this specific crime is that that becomes another tool that we can communicate to a victim that they are going to have more time to get on their feet and to move past the traumatic experience that they've experienced from the perpetrator of that abuse. So that is the view from 40,000 feet of what we attempted to do with that legislative work in the last session. And that's also, I think, a justification for many of those changes and also some of the historical milieu that informs modern anti-trafficking efforts. Something that, again, just to use a law school example, but, we hear about mala and say, mala prohibitum, and common law crimes, the codification of common law crimes. There was no common law crime that said that committing someone to a position of servitude, either in service of a debt or any other species of slave-like conditions, was outlawed. And that's because the modern efforts of ensuring that not just citizens, any person has access to agency in their life was very much an evolution in terms of the criminal law from the 13th Amendment. I've already discussed the 1867 statute regarding peonage, the federal efforts under the TVPA, the state statute that was enacted in 2008, and some of the areas for improvement of that statute. And the ultimate goal of it is not just incapacitation or deterrence or making sure that someone who traffics a thing no longer gets 3 times the penalty of a person that traffics a person, a human being. But it's also a reflection of one of the great difficulties that we have as prosecutors, is that many of the cases that have been published that many of you see in your bar bulletins, like State v. Shorosky Jackson, State v. Wallace Carson, those were massive success stories. And a major part of being able to get the cooperation of the victims in those cases was, in fact, the reason that these were habitual offenders. A large portion, take Shorosky Jackson, for example. So this was a person who trafficked a minor, was convicted of it, facing only a 3-year penalty for that trafficking of a minor. However, because he committed other felonies in relation to prostitution, accepting earnings of prostitution or promoting it, and because of the fact that he was a 3-time habitual offender, that was one of the tools that prosecutors could use so that a victim has the security of knowing that their truthful cooperation in a case is not going to jeopardize their life, and that the bad guy that has traumatized them is going to suffer the consequences, of course, after that case is presented to a jury and the truth is borne out as reflected in the verdict. And so with that, I think concludes the time that I have. Thank you again, Mr. Chair, members of the committee, for hearing from me and hearing from Anthony. And I will wait until the end of all the speakers if there are any specific questions regarding that legislative effort. Thank you.
Good. Thank you very much, Mr. Probasco. Finally, we have Frank Zubia from the Crime Victims Reparation Commission.
Yes. Good afternoon, Mr. Chairman, members of the committee. Again, my name is Frank Zuby. I'm the director for the New Mexico Crime Victims Reparation Commission. I appreciate this opportunity to speak before you with regards to some of our efforts. There's our agency, Mr. Chairman, members of the committee, have 2 primary missions. One is to provide compensation to victims of violent crime in the state, and then in addition, we also are the administering agency for both VOCA, VAWA, SASP, and those are acronyms, and I apologize. Victims of Crime Act money, Violence Against Women money, Sexual Assault Service Provider money, and then also sexual assault money. I want to go back to our compensation. We newly, as of 2013, human trafficking was the new enumerated crime. So as of 2013, we could start cover and any potential expenses for human trafficking victims from that point forward. What was happening, Mr. Chairman, members of the committee, was that there was a lot of service organizations that didn't know what a human trafficking victim was. So one of the things that we did in 2015 was in our strategic planning with regards to our federal funding and also our state funding, we allocated a certain amount of both our VOCA and our state funding to address this particular issue. We currently serve under compensation for the last fiscal year. Our agency provided compensation to 37 victims of human trafficking, either labor or sex trafficking, under compensation. With our state appropriations, we actually received, and thank you to Susan LeBay, because she was critical and instrumental in getting us that appropriation. We were successful at getting the appropriation and have in its reoccurring funding. It's currently $150,000, and it's part of the actual handout that we provided to you. We've solicited that money out to 2 organizations statewide. One is in Albuquerque, and that's New Mexico Immigrant Law Center. And then the other agency is down south in Las Cruces. Those agencies administer our state funding, and they do that primarily for crisis stabilization. And what that is that organizations throughout the state, like the LifeLink, are able to access funding from those organizations fairly quickly, within hours. So those human trafficking individuals can have access to hotel, various, sometimes human trafficking victims only have the clothes on their backs, so they can go shopping to Walmart or Target or whatever to access any basic necessities. In addition to the funding, we also appropriated $439,000 to various agencies like the LifeLink, for human trafficking victims. And part of that appropriation was the LifeLink actually administers that money for transitional housing. So they're able to set up individuals and set them up depending on what the needs of that particular individual is, whether it be 6 months, 12 months, 18 months, or even 2 years of housing. And it's barrier-free housing, so it doesn't have any kind of the limitations that some of our other housing restrictions may have. And that's, sometimes you're required to be, or to have identification, which a lot of times our human trafficking victims do not. So we've kind of set up both our funding and our compensation to kind of alleviate and work together. What's been really nice, and I appreciate the opportunity and the collaboration with all of the organizations that we currently work with, but especially with the AG's office and the LifeLink, is that we work together, Mr. Chairman and members of the committee. And what I mean by that is that we actually talk about various clients and how we could potentially address the needs of the victim. And we have discussions about basic necessities. And what's really, what's been a really good success story, Mr. Chairman and members of the committee, is that these agencies and these clients can access the funding immediately. As we are a state agency and we're under the executive branch, and sometimes it takes us a little bit with regards to paying our bills, because we have agencies that we have to that administer our money. So what we've done successfully is to have these agencies meet the needs immediately for these individuals. In addition, I do want to let this committee know that we continue to solicit federal funding as well. We solicited funding in the spring, Mr. Chairman and members of the committee. We were hoping to get housing assistance under the Department of Justice. They had sent out to solicitation for housing assistance for victims of human trafficking. The solicitation was for $500,000, $500,000. 3 weeks ago, we received notification that we did not receive the funding. So I want to let this committee know that we are always collaboratively, because we solicited that particular funding stream with support from the AG's office, and then also in collaboration with the LifeLink, because the LifeLink would be the agency to actually administer that funding. We at CVRC are always looking out to see how we could potentially share the love, and that's my term for sharing the love in the funding, and looking to see how we could potentially access additional funding to try to meet the needs for individuals in our state. I stand for questions. I think all of us do. Thank you once again, Mr. Chairman and members of the committee.
Well, thank you so much, Frank and Anthony and all the presenters. A very interesting presentation. And we do have a question from one of the sponsors of HB 237, Representative Thompson, and she'll be followed by another questioner, Representative Ferrari.
Thank you, Mr. Chair. And I want to thank all the presenters. Wow, Mark, I learned about my own bill from you today. So the only thing that I think that maybe we left out was that in the bill in 237, we raised the age for it to be a first-degree felony from 13 all the way up to 18. So that was just a minor thing, but I think that's an important one. And then I do have a question. And
just on that point, Representative, for what to be a felony? Prostitution?
No. Currently, if you traffic, it's only a first-degree felony if the child is 13 or below, and then it becomes a less severe penalty as the child is older. But we decided that a child is a child, so up to 18, it would be a first-degree felony for trafficking them. Okay, and then this is maybe opening a box of Pandora's, but QAnon. I'm just wondering from the AG's office, are you getting a lot of, I'll be nice, interesting reports, anything kind of Well, just can you tell us anything about how QAnon has affected things in New Mexico?
Mr. Chair, Representative Thompson, we are, and I'm sorry, can you clarify the question? Just.
I guess my question is, are you seeing some kind of outlandish reports of, of kids being held in the basement of Dion's, or, I mean, are you seeing an uptick in things that you might consider conspiracy theory kind of things, or anything that you could relate back to the rising of the QAnon conspiracy?
Oh, I see. Okay. Mr. Chair, Representative Thompson, that's a good question, because we do get those. I mean, we do get, whenever something comes out in the news nationally, like the Wayford conspiracy that they were talking about, the furniture, and then the Pizzagate, and anytime something like that comes up, we do receive calls, but we look into every single one, and we do full investigation, even if it seems a little far-fetched. We look into it anyway, regardless. I mean, there's sometimes, and I can tell you from personal experience, in the last couple of days, so we've had one that we've been following up on to finally determine that it's just a person feeding off of what's being said nationally. However, we know that these things do take place because it has happened. And there is a concern because some of the activity we see both on the surface web, on the deep web, or as others know, the dark web, we see a lot of conversation going back and forth about children, how to traffic them, how to traffic people, and how to get this done. So we know it does happen. So we take every single report serious, and we look into that.
Okay, thank you, Mr. Chair. And would you be able to say that these conspiracy theories have had a negative effect? I mean, are they overwhelming your investigators? Are you seeing a downside? I don't know how to put this without it sounding like and I understand completely that you have to investigate everything, but has there been a flood of? And then secondly, what are the consequences for people knowingly reporting or misleading or things like that?
Mr. Chair and members of the committee, it isn't overbearing. No, quite honestly, it isn't overbearing. It isn't taking up a lot of our time. We don't get a lot of them, which is nice. I mean, I'm glad we don't get a lot of them, because we do get a lot of serious reports we look into. And unfortunately, now that we're seeing with the pandemic starting in March and everything that's gone on, and all the children are home, they're trying out these new social media platforms. So we get more of those types of reports from different social media platforms, letting us know what kind of activity is going on there. But it really hasn't taken a toll on the way we do things.
Well, I'm glad to hear that. And then I kind of got it all jumbled up. If you find out that someone is reporting misleading things or reporting, what is your avenue to correct that?
Well, Mr. Chair, members of the committee, if we do find someone misreports or makes up something, we could charge them with filing a false report, but many times we try to still get them services they may need. They may need mental health services. So we're going to go ahead and refer them to the proper services. That's our primary objective. Just again, give you an example. This week alone, we had someone that had reported something in 42 different states. The same thing. And after my agents spent a couple of days looking into it, we found that this person is very consistent in what they say, and it's been looked into, and it's basically fantasy or whatever it may be. But that being said, we're still going to try to help this person, give them the direction, try to offer other services to them, and that's the benefit of being a task force. Is we have the availability throughout the state of other mental health services. I also have the Attorney General's office actually has a mental health professional on the team to work with the team dealing with vicarious trauma. And at the same time, I can talk to her and say, who would you best recommend that I send this person to, because this is what they're conjuring up in their mind.
Okay, thank you. And Mr. Chair, we are, Representative Georgine Lewis and I are planning to reintroduce this bill, and we got it through the House. We stalled in the Senate, but we will be bringing it in front of the committee for endorsement. I'm pretty sure. I don't have everybody's word on that, but so thank you all for your presentations and your work, and I look forward to working with all of you. Thanks, Mr. Chair.
Thank you, Representative, and we'll put it on our list. Next, we have Representative Ferrari to be followed by Representative Lujan.
Thank you, Mr. Chair. Can you hear me now?
Yes, now we can.
Okay, great. I unmuted, but nothing was happening. Let's see. I have a question.
I suggest you turn off your video, and I think your audio will.
Yeah, this morning we heard about victims of sexual assault and domestic violence.
Excuse me, Representative. Yeah, good. Try that. Let's see if that works. Go ahead. Start over again. Start over. Yeah.
Okay. I'm at the Capitol. This is for Mr. Zubia. This morning we heard about sexual assault. Am I coming through?
No.
Mr. Chair? Okay. Okay. I was hoping to ask how you have a project to give a voice going through court for these victims of domestic violence and assault, and how that project, the New Mexico Victims' Rights Project, was doing.
Mr. Chairman, Representative Ferrari, thank you for the question. We currently fund a project through New Mexico Legal Aid, and they currently have an attorney that's assigned to represent individuals. And then in addition, they also have a subcontract with the New Mexico Victims' Rights Project. And there are two advocates with the New Mexico Victims' Rights Project that provide advocacy for individuals. They do that also statewide.
And are you aware that that is not continuing with the subcontract, and that the attorney with the legal aid is continuing to victimize the victims and not giving them the orders of protection that they're asking for and canceling them?
Mr. Chairman, Representative Ferrari, we were advised of certain concerns, and we had asked those individuals to both not just to contact us directly. All of the information that we were receiving was secondhand information, and we had asked those individuals that were directly affected to contact our agency. And as of today's date, Representative Ferrari, we have not received any written or verbal complaint from any client that New Mexico Legal Aid is currently working with.
Well, I hate to tell you this, but Mr. Chair and Mr. Zubia, victims aren't likely to go to that extent. This has been reported and going on for over a year, and you've been letting it continue. And I would suggest that since that contract is not being renewed with the women who are doing the Victims' Rights Project, that you do something immediately to stop legal aid from having the same attorney victimize the victims, and to get the people who know what's going on and have been able to help the women in court, and not to be re-victimized, and to be able to have the protections that they need.
Mr. Chairman, Representative Ferrari, thank you. I appreciate you letting us know. The one attorney that I believe you're speaking with regards to, he only does through New Mexico Legal Aid. He's a contract attorney with New Mexico Legal Aid. He only does Las Cruces. So the reason we actually the reason one of the reasons that New Mexico Legal Aid actually asked for the solicitation was that they were able to and they currently have the capacity to tap into attorneys statewide. So if an issue were to arise in Roswell or Farmington, they actually have attorneys that they could potentially tap into and address any victims' rights issues that were to come up in those various areas. Mr. Chairman, Representative Ferrari, our agency has not received any formal complaint aside from secondary information. And what we've asked from those secondary individuals is that they need to contact us directly, and they can remain anonymous. And the complaints can remain anonymous, but we have received nothing as of yet.
Well, I'm sorry. I think that's misinformation to your office, and that the person who's the attorney is a union person that they can't get rid of. And they are not referring anyone to other attorneys around the state. He is handling all of those cases. And he is, that we need, like the Attorney General's office is doing, to have a voice for victims and to give them the representation they need to be able to go through the criminal justice system. And this is not happening for women who are victims of domestic violence or sexual assault. And I think that something needs to be done, and not let this just carry on again, and not continue the people who are with the New Mexico Victims' Rights Project, who are actually doing the heavy lifting and the work and protecting these women. Thank you, Mr. Chair.
Thank you, Representative Ferrari. Representative Lujan, you're next, to be followed by Senator Cedillo Lopez.
Thank you, Mr. Chair. Thank you, committee members. And thank you, everyone, for being on the panel today. I have a few questions, and I think I just wanted to get to the point. I was on committee earlier today, and then I was not able to continue because I had some IT issues. And so I've been on this afternoon for most of it. So I don't know if this was readdressed, but I think this is the portion, Mr. Chair, that you told us to address the issue that we were talking about earlier today about children in the HSI custody, or children in the detention centers and the borders, and our missing children. And I just wanted to talk to our AG's office and others here that what are you getting reported about with these children that are in HSI custody, and their status, and those that are still missing, and what's being done as far as investigations, and what's going on with that issue particularly. If you can talk about it.
Mr. Chair, Representative Lujan, I'm sorry. There was a little bit of distract noise, but I think you're asking what's happening to the children that may be in custody.
Yeah.
Whose custody?
With the federal custody, with our children in detention centers, and our foreign children that are coming across the borders and being detained with their supposed to be detained with their families. As we know, we had missing reports of children and even trafficking that was reported earlier this morning with one of our discussions and one of the panels. So can you talk to us about that and what's going on and how they're being protected and, how we in the state, how we're able to help?
Yes. Okay. Mr. Chair, Representative of the committee. So Homeland Security is one of our federal partners, along with the Federal Bureau of Investigation and several other federal agencies. So we work with them, and they understand that our primary objective is to rescue children and to take care of these victims. And I have spent some time training our federal partners, Border Patrol, and those folks. And if there's a child in custody, they are reaching out to us, to me directly, and then I will assign two of our agents in our office to go out and speak with the child and see what we can do to identify if they are being in fact trafficked and what else we can do to help that child. I'm hoping that we're receiving the calls, but again, this week alone, my agents went out to the Juvenile Detention Center to interview a child, and that's a very common practice when we get those calls. And we do get the calls, and we work very close with various groups and immigration, and they do trust us, and they call us if there's an issue. And we will go out and interview and see if we can determine if they are in fact victims of trafficking and how we can help. And again, we have a great working relationship as being one big task force with our federal partners. So I think we've made some headway with that.
Thank you,
Mr. Chair. Oh, excuse me.
Please.
Mr. Chair and Representative, I think there's a point too that is in there that I think is pretty essential to highlight regarding the importance of state efforts to combat trafficking. Historically. Oh, Mr. Chair, may I elaborate on that point? I want to make sure I'm not interrupting anyone, Mr. Chair. I apologize, but may I elaborate on that?
Go ahead. Point? Yeah. Please go ahead, Mark.
Thank you, Mr. Chair and Representative. And that point is that prior to 2008, the provisions of the federal code, so that's Chapter 77 that deals with involuntary servitude, peonage, and then the labor trafficking statute, which is 18 USC 1589, sex trafficking statute 1591. So what we've seen since about 2015 or so is a pretty drastic reduction in federal human trafficking prosecutions. I think there was a high in 2015 of approximately 224 federal prosecutions. And as of last year, I believe the latest number is 148 federal prosecutions for human trafficking. And so the point that I want to highlight isn't to cast aspersions or to identify federal law enforcement efforts. We do work in conjunction with federal law enforcement at times to make sure that there's just results for survivors. But I think that your point illustrates sort of a nuance here, which is that now that the state of New Mexico since 2008 has prohibited things like involuntary servitude, forced labor, forced commercial sex, that the proactive role that the state of New Mexico can do in protecting people's agency over their own lives has only grown. It has not diminished since enactment of our human trafficking statute. And I just wanted to highlight that. There has been a decline in those federal numbers, and that given the key importance of building a trusting relationship with victims of crime, the state of New Mexico is not in the enforcement of the law with regards to deporting anyone. And so oftentimes we're better positioned situationally to help develop the cases and move them along. And that's why it's so important that we address the human trafficking statute. Thank you, Mr. Chair, for allowing me to elaborate.
Thank you, Mr. Chair. I thank you, Mark. That's really interesting, and I thank you for that bit of information. But it goes to our courts right now are so overflowed. There's the wait lists and so forth, especially in our federal courts right now. I'm just seeing if those issues are coming back into the state and how we're helping, and that really helped to give me some more information. So thank you for that. But it is a huge issue, and I know we talked about it earlier this morning with a 7-year-old child that was that can't even be identified and doesn't even know who his they can't even find his parents. So this is a concern because this is happening in our state. So I wanted to go back to that because I'd missed some of our committee today, and I feel this was the place where our chairman told us to talk about this, and it's a huge concern. And we know we have missing children, and and I know us as a state, we're doing what we can, and I appreciate that information. But it just comes down to us drawing to the point that we need to do more. And I appreciate what the efforts are from our Attorney General's office and just all your information. Some of the other questions I have right now regarding the trafficking, Mr. Chair, and our panelists, as we know, we have areas of hubs of trafficking in the state. Areas where I think that Representative was it Armstrong that identified it, that says these are areas where this is happening. So we know that we're having evictions, and we know we're living in the time of COVID in this pandemic. Do you have any reports or have you gathered information on our vulnerable populations? And what are some of the protections other than, I know we have the hotline and things like that. Is there anything else that we're doing, or we're keeping a more close watch on these areas of concern? And can you tell us anything about that? And how we're protecting our families, especially now when they're in these circumstances where they're losing their places to live. Can you talk about that? Thank you, Mr. Chair.
Mr. Chair, members of the committee, we do have a couple things that we're doing. We are educating the committee, the community in general. We do a lot of outreach. Something that our office does is that we do have an outreach team that goes out and meets with different communities. We've done a lot more outreach now, virtual. And then I'm actually, you brought, this has come up that this week alone, I had a family approach me that they asked me just basically talk to their child because they're not used to dealing with what's going on social media and all the exposure they're getting now because of the pandemic. So we're spending more time educating the community now, working with the school systems, providing them guidance on the different tools that they're using and how to best monitor the children while they're going to school online. And I would say we're seeing more of the vulnerable population in some of the rural areas. That we've got more calls in that areas in those areas recently because now that since the pandemic started, we've seen more calls. But again, we're spending more time doing a lot of the virtual training and education to help them. And in fact, we're working on a PSA right now, public service announcement that we will plan to run on Instagram, maybe TikTok and some of the other social media platforms on educating children that if an individual approaches them online and starts to groom them, that what grooming might look like and what they can do to protect themselves and where to report. And we always give the community the way to report and how to do that. So I personally get a lot of phone calls, and then our National Center receives a lot of phone calls when a child is being exploited some way. And of course, on the human trafficking side, we're getting the same. And I know the LifeLink receives a lot of phone calls as well through 505 Get Free. So I think we're making some headway there as far as educating the public, since we're kind of living in a different time now. And I feel good about it. I think we're going in the right direction. The numbers show that. We've seen an increase in cyber tips, and the reason the increase is there is because people know what to look for now and they know where to call, and we want that to happen because the problem always existed. It's just in greater number now.
Thank you, Mr. Chair. Thank you, Anthony. Yeah. So, are you reaching out through our schools and talking with our parents? Because now, we are getting, as a parent who has a child at home that's in elementary school, are you able to work through our education systems, our public schools, and providing some of that training for our teachers and for our parents?
Mr. Chair, Representative, yes, we are. So whenever we receive a request from any school district, we will provide them the tools that they need to provide their teachers so they can get it out to the families. However, we will also present independently. I mean, we've been asked to go into charter schools, and we could have a parent night, and it'll be a virtual night, and everybody logs in and they hear me talk. Just to give you an idea, what we're doing now is next Wednesday, I partnered up with Shared Hope International, and we're doing a talk for teens to call in, and it's going to be live. It'll be in the afternoon when everybody's home, and that way parents can be part of that as well. And they can call in and ask questions or text in or instant message or whatever they want to do. And they can ask questions of professionals, and I'll be on that panel answering those questions and what they can do. So we're putting a lot of that out there so parents know where to look. And I have a lot of sites that I vet, and I'm actually the national chair for education and awareness for internet crimes against children. So I vet sites, and I try a lot in our state that what's going to work the best. And there are several sites that we're using now to educate families and parents and educators. And I'd be more than happy to share that with all of you as well. And what we found, what we're using, what's the best way to know what your child is doing online.
Well, Mr. Chair, Anthony, thank you so much for that information. That is a big piece. So I just wanted to make sure our schools need to request the training, and that's the best way to get it from you, from the office.
Mr. Chair, representatives of the committee, yes. All they have to do is contact me, and we will make sure that they get the training that they need. We will make arrangements to make sure that happens. And if I don't do it personally, I'll have someone from my team do that.
Mr. Chair, Anthony, thank you so much for that. That is something that's really important, and as we're all spending more and more time online with our families. Thank you so much. Thank you, Mr. Chair, and that's all I have right now. Thank you.
Thank you, Representative. I think Mr. or Dr. DiBernardi wanted to say something as well.
Okay.
Thank you, Mr. Chair, Representative Lujan, members of the committee. Our conversation here today is excellent. However, it's really expanded beyond human trafficking. And I wanted to address, LifeLink does a lot of work besides human trafficking. And we're talking about vulnerable populations. That's the mission that we've done, as well as many, many community partners we have in the state. But right now, things have become extreme with COVID and the situation there. And we're hearing about this pending surge where we're expecting potentially a 25% influx into the behavioral system. Is already taxed beyond the capacity to really function effectively. And I want to assure you, Representative, that we're doing everything we can as an agency to address issues like homelessness, joblessness, inability to pay mortgages. We have literally hundreds of thousands of dollars flowing through the agency through CARES Act funding, other federal funding, to make sure that we are meeting the most vulnerable populations where they are. We've also seen the behavioral health system transform itself over the past few months into one in which we can work effectively remotely.
Awesome.
Oh, we lost you.
To really meet the community needs and meet them where they are. So I think something really positive is going to come out around this if we can continue to allow these modifications to happen and get funding into the system to support us to continue to do that mission. Thank you, Mr. Chair.
Thank you, Doctor. Well, let's go then to the next questioner, which is Senator Antoinette Cedillo Lopez.
Thank you, Mr. Chair. I want to thank the presenters. They were all excellent presentations and extremely informative. I have a few questions, and I wanted to start with the Attorney General. That bill that you talked about, I guess, got stalled in the Senate. I only read bills that actually come before me. I don't remember that bill, not to say that it, whatever. But I was thinking when you were talking, because I haven't seen that bill, I was getting a little bit confused. And so one of the things that I understood you to say is you wanted to make that bill more clearly apply to labor trafficking. And I think that is something that I've wanted to see for a while. But I want to give you this hypothetical, not to be too law professor, but an immigrant comes on the promise of work, comes to the United States, is undocumented. The individual then is working as a home health care worker in a home. The people who attracted this individual to come take away the individual's papers, passport, identification papers, and then don't pay the individual much, if anything. Would the bill has revised cover that situation?
Mr. Chair, I believe I can answer that question if I may. Mr. Chair and Senator, yes, it would. In fact, it would make that fact pattern much more readily apparent by comporting the verbs. For example, in those cases, oftentimes what you see is that the perpetrator of that fraudulent scheme of bringing someone in under these false inducements, of not paying them what is due, oftentimes they'll even seize transportation documents and use the threat of deportation. This bill makes those cases much more readily apparent and provable in two ways. First way is through the verbs that we talked about, harboring and maintaining being the two words that just absolutely cover the majority of those labor trafficking situations that I've seen in terms of fact patterns. A second way that it does it is that it actually sets out a definition that comports with the federal definition of what coercion means, so that it would expressly cue up to a prosecutor, an investigator, to a judge, and to a jury that those are the types of harms, whether it's a harm of deportation or the harm of some other adverse result, either not being free to travel because they don't have that document. And there really is no other statute that contemplates that specific situation, and this bill would account for it. And in terms of in case the senator wants to follow up on this bill, so it was HB 237, and I think it made it to the Senate Judiciary, the Senate Judiciary, I think was the last committee assignment it had, and we just sort of ran out of time. It's one of those 30-day sessions. But to answer your question, yes, and it makes a prosecution of the wrongdoer that does that much more apparent, and the likelihood of the victim getting restitution for moving all the way up here under those false promises, and also setting out the minimum guideline of fair work fair pay for the fair work that they provided under that false inducement, much more clear, because we do clarify in the restitution provision and elaborate what the floor level of it is, which is necessary in these cases to help inform sentencing hearings, restitution hearings during sentencing hearings, and the amount that a victim needs in order to be made whole.
Thank you
Mr.
very
Chair,
much.
I'm sorry, Mr. Chair and Senator, we made it to the Senate Judiciary. We were never heard there. We just ran out of time, so you probably would not have read it. But it did pass the floor of the House unanimously. Thank you, Mr. Chair.
Excellent. Well, you can count on my support. I will study it. I do, and I think this is probably the question to this is just a resounding yes. But we had a presentation last summer before, I don't know if it's Courts and Corrections or this committee, they all kind of blend, where LifeLink's presenters and also some former victims, some survivors of human trafficking testified. And one of the things that they said most powerfully was that this state was attractive, it was a target for traffickers because it was not only easy to beat the charges, but also the penalties were so minimal. And I'm assuming that this bill addresses those issues as well.
Mr. Chair and Senator, it absolutely does. In fact, when I was preparing, let me close the door. I'm sorry, I just moved into a new house and my dog is barking in the background, and I want to be able to answer that question. So I'm sorry. And I apologize, Mr. Chair. It's one of those quirks of working from home, and it's one of those things that happens. I adopted a dog at the beginning of the pandemic from the shelter down in Valencia County, and growing pains, I guess, moving into a new environment must have set him off or something. So, Mr. Chair, Senator Cedillo Lopez, yes, it addresses that. And in fact, one of the things that came up, because I testified as an expert on this bill last year, and as far as I could find, anywhere in the United States, the state of New Mexico has the lowest penalties for adult trafficking of any place that I could find. When I started looking internationally at, how does Europe handle it? I think the only European countries I could find with lower penalties for human trafficking were, again, not to cast aspersions on former Soviet bloc countries, but I think it was Poland and one of the former countries that was a part of Yugoslavia were the two countries that I was able to find that had lower penalties for adults. Virtually every other country, even countries that face international criticism for their human trafficking penalties, have higher penalties than us. And that country that I'm referring to euphemistically is Germany, which has famously relatively low penalties, but even they have higher penalties for perpetrators of this abusive conduct than the state of New Mexico currently has.
And my third question, I believe that Representative Lujan really addressed it, and that was about the separation of children at the border and releasing them to traffickers. I expect that practice that the people who take children are better vetted, and I expect that that's been addressed. Is that the case?
Mr. Chair, Representative, yes, that has been vetted. We are working close with CYFD and other partners to help them vet them better, to identify those traffickers. I think it's still, some of it's still a work in progress, but I think we get the phone calls, we reach out, as I mentioned in my presentation. We have a good working relationship with CYFD. If their investigators go out on a call, it seems suspicious, it falls within what we've trained them on to look for human trafficking, that tip is immediately sent to me, in addition to the jurisdiction that it's taking place. And then we'll work with that law enforcement agency and those service providers to help that child or in that area.
Well, in that particular case, the mother it was unknown because the child was removed from her or his parents so young that the child was not even able to identify the mother. And so I'm wondering about what kind of, and what I was told is the child is likely to spend the rest of his life in the foster system. And I'm interested in what kind of efforts would be made to locate the mother who has been deported to Honduras.
Mr. Chair, members of the committee, I don't have an answer for that, but it's something that I can certainly look into.
It was just such an outrageous story. It stuck with me all day, and just I was absolutely devastated. But I thought that Representative Lujan asked some very good questions relating to that. So I'll just leave it at that. But it was just very disturbing to know that a child being separated from his mother at the border would then be let into a trafficking situation at such a young age that the child would not be able to assist in locating the child's parents. And it was just such a devastating story. And then my heart just went out to the parents who have lost their children to trafficking. And finally, I have a question for Mr. Zubia. Mr. Zubia, I meant to send you a private chat, and it actually went to everybody, so I might as well just address it. And what my private question was, and maybe you can explain, what is the process for investigating legal services that are when there are complaints about legal services? And my specific problem is we know that victims have a hard time complaining about any services that they receive. They're so vulnerable. So and it sounded like you were willing to take complaints from the individuals who work with the people who are victimized by the attorney. And and so what is the process then? If you, my concern is I assume you don't just sit and wait for complaints, that you would take an active investigation if you hear something like this, and there was certainly enough for an investigation. It was a very disturbing story, and I guess I want to hear more.
Mr. Chairman, Senator Cedillo, with regards to Representative Ferrari's concern, we did reach out to New Mexico.
I'm sorry, I can't hear.
Try now, Frank, with your video off, it might work better.
I think it might be his internet connection.
Yeah.
He's back. I see him.
Can you hear me now?
Now I can, yes. And Mr.
Okay. I apologize, Mr. Chairman, Senator Cedillo, and I apologize. I didn't talk. I mean, I didn't know that you all could hear me. When we received the initial concerns with regards to New Mexico legal aid, we did reach out to. There is a process. It doesn't necessarily have to be a formal process with regards to complaints. We receive verbal and written complaints, and sometimes they're anonymous. And sometimes we follow up on all of our complaints. We directly reach out to the leadership of the organization, and then in addition, we also reach out to their board. We ask them about, let them know about the concern. We give them a timeline in which to respond. With regards to what Representative Ferrari had, that particular issue, we did reach out to New Mexico Legal Aid leadership. They conducted their own investigation with regards to what was being alleged, and it was unfounded. So what the leadership then responded to us was that they were hoping to meet with the contractor, and those are the two victim advocates that are providing advocacy with the Victims' Rights Project, and they were potentially rectify the situation internally. We were in agreement. It was my understanding that the Victims' Rights Project refused and did not want to continue to collaborate with New Mexico Legal Aid, and since the contract is with New Mexico, they then decided to terminate the contract with the Victims' Rights Project. Mr. Chairman, Senator Cedillo, that's kind of our process, but I do want to let this committee know that we investigate all allegations, whether it be verbal or in writing.
I just want to suggest that when a contractor with CVRC has to investigate themselves, when there's a complaint about their work, they have a lot of incentive not to reveal to you that there's a problem. So it may be worth an independent investigation. And since legal aid so the Victim Rights Project cannot contract independently with you and not have to collaborate with the legal aid?
Mr. Chairman, Senator Cedillo, that is correct. So the contract and the solicitation was with New Mexico Legal Aid, and they ultimately then subcontracted with the New Mexico Victims' Rights Project. It's my understanding, Senator Cedillo, that the investigation was, there was a corrective action plan by New Mexico Legal Aid. And the corrective action plan was to try to mediate and try to work out the differences between the two organizations. And they were going to bring in an independent mediator to make that happen. But it was my understanding, and I was told, that the subcontractor chose not to participate in the mediation and ultimately chose to terminate the contract.
Oh, well, we can speak more about this offline. However, I do want to make the point that mediation is usually not an appropriate resolution for a situation with, as you know, better than anyone, I'm sure, alleging abuse. And the thing is in my experience, when I ran Enlace Comunitario, if I had a client complaint about an attorney, I did not permit the attorney to meet with any client until that there was an investigation. And in fact, I had to terminate an attorney because there's a power imbalance. And particularly when you're dealing with victims, you have to be very, very careful because it's easy to get into yet another dynamic that is damaged. So you have to really watch this carefully. And I will continue to speak with you about this offline. And I'll just leave it at that. Thank you, Mr. Chair. That's all I have.
Thank you, Senator. We have Senator O'Neill, and then we have Representative Garcia on the phone. So let's do Senator O'Neill first, and then Senator Garcia.
Hi there. Can you hear me, Mr. Chair?
Wait.
What's that?
We can hear you fine.
Okay, thank you. Thank you, Mr. Chair. And thank all of you for your presentation. Hello, Frank. I haven't seen you in a while, but keep up the good work. This is such an important issue, and it's a dark issue. It's just something that's really, really sad, but we need to do better protecting folks. So I guess what I'm curious about, I just have a couple simple questions. Who was the sponsor of House Bill 237? Mr. Chair, panel.
Mr. Chair and Senator O'Neill, the two original sponsors were Representative Liz Thompson, excuse me, my words are like slipping, and Georgina Lois as well. They were the original sponsors, and I know at a later point many other representatives at least jumped on to support this bill, which passed unanimously. I don't believe, and Representative Thompson can correct me, but I don't believe there was any sponsorship on the Senate side, though. But I may be incorrect in that.
And then, as a member of Senate Judiciary, Mr. Chair, did we hear that bill? Did we actually hear it last session?
And Mr. Chair and Senator O'Neill, I don't believe it was ever heard. I think we just sort of ran out of time during the last session.
And finally, Mr. Chair, panel, and Representative Thompson, it's so powerful when you have survivors willing to talk about their experience. And the reason why I ask these questions is I do have a constituent. I have not met her, but she's a survivor of human trafficking, and she seems to be doing really well in her life. And she's expressed a strong desire to basically be a part of this. So I just wanted to give you, Representative Thompson, a heads up on that if you need a personal, survivor statement. But it sounds like you already have that. But it's just I've been meaning to contact the sponsor of this bill with that information. So thank you so much, and keep up your advocacy, and we can do better. We just can do better on this front. Thank you.
Yes, Mr. Chair, thank you, Senator O'Neill. And we did, and I believe it was the AG's office who arranged for us to have survivors. And we also had a mom with her daughter. And it's really hard for people to ignore it when you have, and they were all women. So thank you for that. And if you would like to, please give her my contact information and have her reach out to me.
Okay, thank you, Rep. Okay,
thank you, Senator. Thank you, Mr. Chair.
Thanks, Mr. Chair.
Thank you both. And then we have Representative Miguel Garcia, who's with us via phone.
Thank you, estimado Chairman. Am I on? Mr. Chair, can you hear me?
Yes, we can hear you just fine. We can hear you just fine.
Bueno, gracias. Thank you, Mr. Chair. I'm glad that I was able to kind of catch this second panel on combating human trafficking. The first one I missed, Mr. Chair, because I was laying down some fish fertilizer on my garden. This hot weather has really kind of spurred up perked up our gardens. So my Armenian cucumbers and zucchini, Mexican squash, and heritage corn are doing great in this hot weather, and that additional layer of fish fertilizer is just going to really speed up the production. But Mr. Chair, I've got some questions to the panel, and I want to say, Mr. Chair, that I kind of sense kind of a deep feeling of compassion and caring from all the panelists on this kind of horrendous issue. I have some questions regarding trafficking arrests, trafficking convictions, ethnicity of traffickers arrested and convicted. And I guess my specific question to the panel is going back 6 years, 2014, what has been the number of trafficking arrests by year? And also, what has been the number, again, going back to 2014, what has been the number of trafficking convictions for those past 6 years? And, Mr. Chair, what is the ethnicity of those arrested and convicted? That's my first set of questions. So panel, did you kind of understand that?
And I can jump in on at least part of an answer to that question, and I'll have Anthony supplement it. I don't have the numbers on hand. I can inform the Mr. Chair, excuse me, assuming I can answer this question. Mr. Chair and Representative, in regards to the most recent conviction, I do have information on that. We had a bunch of teachers at the Lew Wallace Elementary School that saw some indicia of trafficking of young children that were in the classroom. Were not being taken care of, were being removed from school. And recently there was a conviction regarding, his last name's Stewart, I can't remember his first name. In terms of the identifying information, I believe he's Caucasian, and I believe his sentence was 18 years incarceration for labor trafficking of his children. Essentially, he removed them from school to force them to panhandle so that he could afford to get drugs. I can't comment on the other facts and attending circumstances of that case because they are pending trial, and I don't want to comment on it while there's still a pending litigation, but I can mention that specific conviction. In regards to other convictions, I mentioned the case for which there's a probation violation and the Shirosky-Jackson and the Wallace-Carson cases. And so I can inform Mr. Chair and the Honorable Representative that that's a minimum of 4 convictions over that period of time. But I don't have the data on hand to answer that question fully. And so I'll look at compiling that information should there be a substantially similar bill to HB 237 that's introduced in this next session. I also don't have the demographic information for those other offenders. The PV, for example, was telephonic, and I just don't recall what that component was. It is important to note that depending on the specific sort of marketplaces at issue, that trafficking offenders meet any demographic profile. In the commercial sex context, predominantly the most important demographic piece of information is that the survivors of that species of trafficking are female, and that the perpetrators of that specific type of abuse is male. I'm unaware of any sort of, I believe that Mr. Chair, Representative, you requested racial characteristics regarding it, and I just don't have the data on that because I just know that based off my direct experience, but I can't think of the names or the years for those specific cases, since most cases actually do not result in a criminal case for the very reason that I identified for this committee, which is the difficulty of securing cooperation from someone who has been so deeply traumatized, and some of the weaknesses that we can improve our trafficking statute so that our survivors can have the confidence that their testimony will matter at the end of the day in securing a life that's free and independent of the person that traumatized them. And so that's the information that I'm able to provide at this point in time, and I'll turn it over, Mr. Chair, with your permission, to Anthony Mays.
Well, let me first of all kind of clarify the question. I just wanted some real basic data going back to 2014 in terms of trafficking arrests, a number by year. Say 2014 there was 8, 2015 there was 5, et cetera, et cetera. Also, just basic data in terms of trafficking convictions going back to 2014 by year. Again, 2014 we had 2 convictions, 2015 we had 1, et cetera, et cetera. And also the ethnicity of the traffickers that were arrested and convicted in those 6 years. And then one last data or demographic is what was the average sentence of those convicted? So you were going to pass it on to Anthony, Mr. Chair?
Yes, if you could, Anthony, if that data is available in a report, maybe you could make it available to us, or if you could gather it for the representative, that would work too.
Yeah, to the committee.
Mr. Chair, Representative Garcia, members of the committee, most of that data is available. The Attorney General's office started the human trafficking side of the task force in 2015, started monitoring and gathering those stats, and then of course investigating and prosecuting. So I'm confident we can pull some of those for you. Not everyone reports as they should, just with the, people are in society, they just don't report everything. So that goes true with some of our professional affiliates. But I can provide you what we have in our database. I can put a report together for that. I can certainly provide you reports dating back on the Internet Crimes Against Children side, dealing specifically with child sex trafficking, dating all the way back to 2008. So that wouldn't be a problem. And the reports we do provide Office of Victims of Crime for our human trafficking grant would include all those categories that you requested. But if you could just give me some time to put that together for you, and I can get it to you.
Well, I'd appreciate that, Anthony. And you're a Maes, and I want to let you know that the correct spelling of our surname, because I'm Maese through my great grandma, is M-A-E-S-E. That's the old Spanish colonial Spanish surname. And there's only one Maese family in New Mexico. So I guarantee you that me and you are cousins. Mr. Chair, I have another question. It deals with services to victims of trafficking, and maybe the specific panelists can answer this. But I wanted to ask on that, services to victims of trafficking, if there are limitations. And what I mean by limitations, I mean if the victim is undocumented immigrant. You mentioned that there were certain services earlier, like housing, clothing, et cetera, that are issued. And I want to know, under the statute that we have, if there are limitations in terms of services to victims.
Mr. Chair, Representative, I'll speak to that. Lynn, I saw logged off. So from the service provider point of view, there are no limitations. We will work with whoever comes. And as Frank mentioned earlier, through our partnership with CVRC, we're able to create a housing program that does not have those barriers. Any housing programs funded through HUD require that people be documented, but in a no barrier program, we can provide those services. So I will say, though, interestingly, out of the, I would say 300 to 400 victims we've worked with over the past 5 years, there's only been a handful that were undocumented. The big misunderstanding I think that many people have is that these are all people coming from over the border. No, these are all people, or the majority of the people who are from our state and from nearby states passing through. But we make sure that there are no barriers, and we, if we can't find funding to support someone, then we as an agency will take the hit in making sure that that they get the services that they need. Also, however, and maybe Frank can speak to their limitations on their funding, we've created really good collaborative efforts for all of us to kind of get together and figure out how to best serve the needs of these victims, regardless of legal status.
Thank you. And my last question, Mr. Chair, has to do with the victims of trafficking. And I guess that goes back to maybe that 6-year span to 2014. But of the victims of trafficking that you guys and gals have kind of come across, how many were on probation and parole?
Mr. Chair, members of the committee, again, that would probably be a number that I'd have to look up as well. I couldn't tell you right offhand. From my personal knowledge, and again, I'm getting up there in age, so from what I can recall, the number was not high at all. It's not something that we're seeing. But I can certainly add that to another category that we could look up as well if you'd like.
Yeah, I'd appreciate that. And
just
again, and thank you, Mr. Chair. Gracias.
Mr. Chair and Representative, just one quick supplement to that answer. Another source of information, especially regarding the number of trafficking cases, that I think would be very accurate because it doesn't rely on self-reporting, I think could come from the Administrative Office of Courts. I know that they have to enter in those codes, the charging codes, whenever an indictment is filed. And so they might actually be the best source of information because there's the potential for sort of selection bias in numbers that are, self-generated, whereas AOC, I think, would have the most objective source of information since they do track those codes. And I think also the indictments should include the demographic information for the alleged offender or, if the case merits it, a convicted offender. And that's just something that I want to make sure that the committee hears that could be a valuable source of information as well.
Thank you for that. And thank you, Mr. Chair. Panel.
Thank you, Representative, and panelists, thank you very much. Unless anybody else has a comment or a question, I think we've completed our agenda for the day. We will resume tomorrow morning with another full day of fun and games at 9 o'clock. And tomorrow's agenda calls for us to hear about food insecurity, the eviction crisis, services for veterans, and services for the homeless. So it's going to be lots of information. And I want to thank everybody for coming today. We had 22 members in and out, but over 22 members were part of this committee today. And I think that's a testimony to, it's a testament to how eager you all are to really find out what's going on because of COVID, but also just generally on health and human services. So unless somebody else has some comment, and I just want to thank the panelists for great information. We look forward to the legislation coming forward. If you want the endorsement of this committee, it needs to be submitted a couple of weeks before our last meeting of November 12th. Yes.
Mr. Chair, I just want to make the comment. I should have asked the question about what resources are available to investigate. One of the things I hear about and heard about, especially with when working with El Centro de Igualdad y Derechos, is a lot of these home health workers are deeply in the shadows, and there's just no way for them to get resources, no way, because they're at home with no papers in somebody's home, they're hearing a lot of stories about this. So I wanted to distinguish between the fact of human trafficking and those who receive services. And so the idea that there aren't a lot of undocumented people who are trafficked wasn't exactly correct. I agree that more undocumented people receive services, but I'm not sure that there are more undocumented people that we're not aware of. And I just wanted to make that point. But thank you, Mr. Chair. It was a great day and excellent presentations.
It was. I want to thank the staff for arranging. I want to thank the staff for arranging such good panelists. And we look forward to tomorrow. So thank you all, and we'll see you in the morning.
Mr. Chair, if I may,
Yes.
and members, I will be sending out a new WebEx invitation, as the one for today will not work for tomorrow. So expect that here shortly. Thank you.
Okay, thank you. Thanks, Sabina. And we look forward to seeing you all. We'll get started right at 9 tomorrow morning with introductions, and then we'll move on. Thanks a lot.
Thank you.